Morning, everyone. Welcome to, I think, the largest collection of tick experts we've ever assembled in one place on this island. Not sure if that's a good or bad thing, but you're in for a fantastic morning this morning. I'm Jeff Levy. I'm the CEO of Martha's Vineyard Medical. On behalf of our practice, I want to welcome you. Give you two quick logistics. The bathroom is back this way if you need it. In the back of the room, there's coffee over here, and there's a bunch of informational literature in the back that you're welcome to take, and I would encourage you all to do that. I'm going to now introduce Jerry Yukovich, who's going to be your MC and ringleader for the morning.
Good morning, everybody. I'm Jerry Yukovich. I work at Martha's Vineyard Medicine, and you see me at the Martha's Vineyard Playhouse as well. So this is the island where you can do all kinds of stuff. Now, I know it's an imaginative group here, and I want you to remember the next time you have a birthday, I want you to close your eyes, and before you blow out the candles, make this wish. Please let the ticks pick on people their own size. Okay? Remember that next time you have a birthday. It might come in handy. I want to thank our sponsors, which are listed: Project Lyme, the Johnson Family Foundation, the Island Tick-Borne Illness Prevention Fund, the Fledgling Fund, thank you, Diane Barrett, Martha's Vineyard Hospital, and D-Best Construction. So we're going to cover a lot of territory. We're going to cover a lot of territory today. There'll be time for questions from time to time. From 9 to 9:10, I'm going to be introducing, that's what I'm doing now, if you didn't notice. Then Aubrey Ryan and Ed Caldwell are going to come up here and give a general picture of tick-borne diseases on the island. Then we're going to have a little panel with some of the Martha's Vineyard Medicine doctors fielding questions and talking among themselves about the challenges of treating tick-borne illnesses on a daily basis, which is what we do. Patrick Roden-Reynolds and Paul Elias are going to come on and tell you how to prevent, and prevention is the big thing. I'm figuring if we can prevent at least 10 cases of one of these diseases, this conference will be a success. Anything more than that would be welcome too. Jake Tidaldi is going to talk about tick-borne illnesses. He's a veterinarian, and you might want to have some questions for him. Then we're going to have a couple personal stories about people who have suffered from alpha-gal syndrome. Jo Marie Solet and Georgi Prevosti will be up here later to do that. And Sam Telford and Dick Johnson and Isobel Renai are going to give you some of the latest information in tick-borne diseases. Most of all, I want to thank Michael Loberg, who passed away not long ago, for his efforts. Melinda, his wife, is in the audience, and they've been a great supporter. As you probably know, Michael started a major study on tick-borne illnesses on the Vineyard, which went on for, I think, 4 or 5 years, mostly from a grant from the Martha's Vineyard Hospital. But that got a lot of people thinking about it and talking about it. And I think we've advanced them to some degree. And I've been on the island now for close to 30 years, seeing a lot of cases of various tick-borne illnesses, and doesn't seem to be getting any better, unfortunately. So I'll now introduce Aubrey Ryan, who's a PA at Martha's Vineyard Hospital. She's also kind of an expert at world international medicine. And Ed Caldwell is our island ENT doctor and allergist, and they're going to tell you a little bit about alpha-gal and other types of tick-borne illnesses. I think we can applaud them. They told me to sit up here while he's got their talks.
Okay, so I'm going to just stand and kind of reference my slides here. So my name's Aubrey Ryan. I'm a physician assistant at the Martha's Vineyard Emergency Department. I've been here for 4 years. I have a background in global health and travel medicine, infectious disease, and I've really been kind of digging in deep to the tick-borne illness that we see on the island because of the patient population that I see in the ER, the things we manage there. Okay, so we can go to the next slide. Should I just cue you for that? All right. So brief primer. This is probably going to be the longest little PowerPoint that we do here, just to give you a primer on ticks and tick-borne illnesses at Martha's Vineyard. Go ahead to the next slide. So these are our ticks. Many of you guys are aware of this. We have the deer tick, which is also known as the black-legged tick. We have the Lone Star tick, which is everybody's favorite tick to hate right now for a number of reasons. The American dog tick, which used to be the one we saw all the time. Seems we're seeing less of them, but they're still here. And then the Asian longhorn tick is now confirmed to be on the island, but its significance in terms of transmitting infectious disease is not quite known at this time, but it's not an area of high concern at the moment. You can go to the next slide. So the illnesses that we worry about specifically on the vineyard, and there are several more tick-borne illnesses nationwide, but these are the things we worry about here, include Lyme disease, and this is in order of how frequently we see them. Lyme disease, babesiosis, anaplasmosis, Rocky Mountain spotted fever, ehrlichiosis, tularemia, Borrelia miyamotoi disease, Powassan, Starry, and alpha-gal syndrome. Does anybody know why there's 3 little asterisks next to the alpha-gal? It's an illness, but it's not an infectious disease. And that's really important. We'll talk more about that later, and Ed will talk about that as well. You can go to the next slide. So this is just a really nice graphic that shows you the reportable tick-borne illnesses in Massachusetts and in Dukes County in order from most common to least common. And it shows you which ticks carry which diseases, which is really important to know. So this is a graphic that I like to show to patients, and it's like a nice reference to have at home. If you have a tick bite and you can identify the species, you think about what you need to worry about. You can go ahead to the next one. And that's, so the deer tick. This is the one we used to see very commonly. It's shaped in this sort of ovoid way. The female has a really orange body. It's the only tick that sort of has that orange color, and it does help us identify it. And we worry about the nymph and the adult female the most in terms of biting humans and transmission of disease. You can go to the next slide. So they're typically found in the deciduous forests and tall grasslands, as well as the shrubs that border the forests. Their distribution really relies heavily on the distribution of their reproductive host. So they reproduce in large numbers on the white-tailed deer. So where there's deer tick, and we'll talk more about what that means in terms of tick control. It's the nymph that's our worst offender. Those are the ones that are transmitting the most disease to humans in large part because they're small and we don't see them as readily as we do the larger adult females, which also transmit disease, but people tend to notice them more quickly and pull them off before there's an opportunity for disease transmission. So deer ticks carry the majority of the diseases we have on the island. All of those there are things we have to worry about with a deer tick bite. You can go ahead to the next one. So this is our dog tick, not a benign tick, but still something we really worry about here. You can go to the next slide. So they prefer the forest edges and areas with little to no tree cover. They like grassy fields. These are the ones that if you go to the beach, they're often hanging out in the dune grass and along walkways and even trails and along sidewalks. The adult males and females are active from April to early August. These are the ones that are often questing. That means they have their arms out and they're kind of looking to attach to whatever passes by them. And they commonly feed on humans and climb up to the crowns of our heads, although you can find them anywhere on your body. They're much larger, they're easier to see. The nymphs and the larvae rarely feed on people or pets because they prefer smaller animals, but they can bite. These nymphs and adults are responsible for transmitting Rocky Mountain spotted fever, which a lot of people are surprised to hear that we have here because not the Rocky Mountains, and tularemia. So Lone Star, this guy, I guess I should say this girl. So the female Lone Star tick has that characteristic white spot on its back. They do aggressively bite and they are known for actually seeking out their blood meal. They don't just wait questing in the grass, they will also crawl towards the source of heat or whether it's carbon dioxide or whatever, but they'll come and find you. And they pose a significant problem in all life stages for a variety of reasons, some of which I'll get into in the rest. Ed will. You can go to the next stage. They have a much broader habitat than the deer tick. They really like it everywhere. Patrick will tell you some more about this, but They like the lawn, they like the woods. They're much hardier in terms of their ability to tolerate dryness and warmer temperatures and colder temperatures compared to the deer tick, which is a little less hardy and has some more specifics in terms of the environment that it wants. And they're very adaptable to different environments. They can transmit ehrlichiosis, tularemia, stari, and they are responsible primarily right now. The biggest issue that we're dealing with is alpha-gal syndrome. You can go to the next slide. These are less of an issue, but it's important to bring up because it's been in the news as a potential source of concern. It's not something we really need to worry about right now, and it doesn't really change much in terms of how we manage ticks and tick bite prevention and disease on the island. But they're native to East Asia. They were first documented in Massachusetts in 2022, but they were first documented here by our very own Patrick, wherever he is, in 2023. What's interesting about this tick and potentially problematic if they do wind up being a source of infectious disease is that they reproduce essentially by cloning themselves by something called parthenogenesis. We have an almost entirely female population of these ticks, and they're able to clone themselves in large numbers. So that's kind of an issue if it turns out they're a significant vector of disease, and we're not sure that's going to be the case here. They tend to prefer livestock and other animals, and they will infest in large numbers, big clusters that you can see on animals. They do spread diseases to humans in other parts of the world. Here, they can carry Lyme disease and anaplasmosis. I think there were some studies out of Pennsylvania that found that these ticks did pick up those diseases from animals locally. So it stands to reason that could happen here. But there's been no documented transmission of diseases from Lone Star ticks in the United States to humans. So it's something that we just need to keep an eye on. But again, it doesn't change our management. It's going to be the same. Tick bite prevention, pulling them off, and managing. So go to the next slide. So Lyme is still our biggest burden. You can see in 2022 to 2023, for every 10,000 Dukes County residents, 143 of them were reported to have Lyme disease. And compared to the other diseases, that's really kind of a big deal. And this is from Leah Hamner at the Martha's Vineyard Board of Health, who has done incredible epidemiological work here and couldn't be here today. But her data collection and putting these sort of slides together has been really helpful all around, but especially for clinicians, as we're looking at concerns and what's the biggest concerns for patients. Okay, you go ahead. So Lyme disease, transmission is by deer tick only. One of the biggest questions I get in the hospital is people come in with a Lone Star tick bite and they're like, I need doxycycline for prophylaxis against Lyme disease. Lone Star ticks do not carry Lyme disease. Deer ticks are the only ones that carry Lyme disease on the island. It's caused by a bacteria in the tick's gut. The transmission usually occurs after the tick has been attached for at least 36 hours. So if you have a tick on you and you're certain it wasn't there an hour ago when you got back from your hike, pull it off. Don't worry about it. It's really the engorgement status of this particular tick that is what has the risk of Lyme disease associated with it. They need to be full and fat to essentially regurgitate, for lack of a more eloquent term, what's in their gut back into you. So it's important to find them quickly though. Most humans are infected by nymphs in the spring and the summer months, but infection can also occur by adult deer ticks, usually in the cooler months. Those again are larger and they're typically noticed sooner than the nymphs, so I think that's why they're less of a concern as far as disease transmission. You can go to the next one. Early stages of Lyme, and we're going to spend the most time on Lyme because it's the biggest issue. Well, first of all, the incubation period, the time until you feel sick, is usually 3 to 30 days, so it's pretty broad. I get that question a lot, like, when am I going to know? How am I going to know? And it's a broad range of time you have to be paying attention to your symptoms. And the problem is those symptoms are often very vague and flu-like, which is the case with a lot of tick-borne illnesses. They can seem like COVID or flu or any other viral condition. Fevers and chills, swollen lymph nodes, body aches. You're feeling tired and sort of just generally, a headache. The big one is erythema migrans, which many people experience, but a lot of people don't, or they don't notice it. And that's that red round rash that sometimes can look like a bullseye. This is a patient I saw, and it's a classic rash. It expands pretty quickly over the space of several days. It can be very variable depending on your skin color. It can be solid, it can be faint. It's usually not painful or itchy. It's usually warm though. And 70 to 80% of people will experience this with Lyme disease. but a lot of times people don't notice it because it may be in a spot on their body they can't see. You can go ahead. So in later stages, 60% of patients will progress to what's called disseminated Lyme, when the infection really takes hold in your body. And there are pretty diverse and significant symptoms and manifestations that people can have that range from neurological ones, such as Bell's palsy. When we see Bell's palsy, which is a paralysis of one side of the face, one of the first things we think of, aside from stroke, and there's a distinction in the kind of paralysis with stroke, is Lyme around here. So we treat based on seeing Bell's palsy for Lyme quite regularly once we've ruled out a stroke. Musculoskeletal manifestations, joint pain and swelling, and rheumatologic symptoms, and then dermatological, which can be the spread of that erythema migrans rash all over the body, and other kinds of non-specific rashes. And these typically appear from weeks to months after you have a tick bite and are infected with Lyme and have maybe missed that early stage because it's so vague. Okay. So treatment is doxycycline. There are other antibiotics available if you have a doxycycline allergy, and that's the case for all the things we're going to talk about today, but I'm going to talk about only primary treatments. It's an antibiotic because this is a bacteria. The duration of the treatment really depends on the stage of the disease. So in some cases, it's 10 to 14 days. In other cases, it can be as long as 21 or 28 days, perhaps longer depending on how ill you are. And of course, it's not a benign drug. It is an antibiotic. It's tolerated by most people. And I'm saying this only because I see a lot of patients that are like, I'll just keep taking doxy. It has side effects. It can cause a lot of gastrointestinal upset, and there's a lot of sun sensitivity, which is problematic for our population where we're outdoors all the time, working on the land and in the water, and just enjoy being outdoors. Next slide. So prophylaxis, Lyme, that's prevention of Lyme disease. Lyme disease is the only tick-borne illness locally for which we can give you a medication to hopefully prevent the transmission of this illness after you have a bite from an engorged deer tick. And that prophylaxis is a single dose of doxycycline, and it's been shown to prevent Lyme in 87% of cases. However, those studies are a little questionable. They're not very robust, but a single dose of doxycycline is not really considered very harmful in most cases. And we tend to err on the side of caution and go ahead and give you this medication. A single dose is fine in kids in pregnancy. That's a big question that I'm asked a lot. So if your kid comes in with a tick bite, I will give them a dose of doxy. If you're pregnant, I'll give them a dose of doxy. Oh, so for kids, so adults, it's 200 milligrams one time. For kids, it's 4.4 milligrams per kilogram one time. So it's very weight-based. The normal dose of doxy when you're taking it for treatment is 100 milligrams. We just hit you hard with 200 milligrams once. It does not prevent against other tick-borne illnesses or the formation of alpha-gal. This is a huge question I get asked in the ER. You get a tick bite. A lot of times people don't know what bit them. If you come in and you say, I had a tick on me, I pulled it off, I crushed it, I don't know what it was, I'm going to give you doxy. Even if we, could have been a Lone Star tick, but we don't know. I'm going to give you the doxy. But the important message is, be aware, you have to pay attention for the signs and symptoms of other tick-borne illnesses that tick might have carried. It does not prevent against those diseases. You have to be aware. And then, as we know, alpha-gal, not an infectious disease, have to be thinking about that too if we're not sure of what tick bit us. You can go to the next slide. Okay, so babesiosis. This transmission is by the deer tick primarily. It's caused by a protozoa. It infects your red blood cells. This is kind of the classic, I just think this is cool. Under the microscope, the finding for Babesia inside a red blood cell is what's called a Maltese cross. So we see that on blood smears that we do in the hospital, and we go, oh my gosh, this patient has Babesia. Incubation period is typically 1 to 4 weeks. Many people have no symptoms. 50% of children have no symptoms, which is a little bit scary because Babesia can be extremely dangerous in its advanced stages. Again, symptoms that are really vague: fevers, chills, sweats, headache, nausea, vomiting, all those kinds of things. Oh, fatigue's in there twice. I guess it makes you really tired. Yellowing of the skin, enlarged liver. Symptoms can range, but for patients with severe babesiosis, the risks are usually if you don't have a spleen, you're immune compromised, you're older. And in these cases, this can be life-threatening. I've had to transfer several patients with Babesia. Many of them I just put on meds and they're fine, but Babesia is very dangerous if it's not caught. It's treated with 2 drugs called Tick-Borne and azithromycin, and it is the only local tick-borne illness that's not treatable with doxycycline, other than Powassan, which is a virus. The interesting thing about babesia is that 4 to 5% of patients who have, and I think that number is actually a little off, it might be a higher number now, but 4 to 5% of patients who have babesia will also have Lyme disease. And that only matters because these drugs don't treat Lyme disease. So this person will also need doxycycline. So it's really important to bear in mind that you can have more than one tick-borne illness at a time. And while most of them are covered by doxy, in this case, you need to think about making sure you're covering for both of those things. You can go ahead. So anaplasmosis, transmission by deer ticks, they're the worst. Another bacteria, incubation 5 to 14 days. Symptoms again are vague, very vague. And for whatever reason, 20% of patients will have like more pronounced gastrointestinal symptoms like vomiting, diarrhea, decreased appetite, and like 10% of them roughly will have a very strange non-specific rash. It's not an erythema migrans, it can take all different forms. So it's kind of vague. Again, co-infection with Lyme disease is common, but if you're treating for Lyme disease, you're also treating for anaplasmosis because the treatment is doxy. You can go ahead. Ehrlichiosis, lone stars and deer ticks will give you this bad boy. Also caused by a number of different bacteria sort of the same species. Lone stars carry 2 bacteria that will cause this disease, and the deer tick carry a different one. Incubation is 5 to 14 days. Symptoms are non-specific, again, very vague. Rash is more common in children, but in this case, ehrlichiosis can result in some pretty significant neurological symptoms and also cardiac inflammation. So this one, when I hear patients come in with a history of tick bites and they're telling me they're having chest discomfort and things like that, we think about ehrlichiosis. Same in Lyme. And the treatment is doxy. Hooray for doxy. So keep going here. We're almost done. Rocky Mountain. So this one's from the dog tick. Unusual because only 4 to 6 hours of attachment time is required for the transmission of Rocky Mountain spotted fever. It's caused by a bacteria, again. Incubation period 3 to 12 days. Early symptoms are kind of pronounced compared to the other ones. You get very high fever, severe headaches and malaise, body aches. There's a classic kind of presentation we see where there's a lot of swelling in the face around the eyes and swelling in the backs of the hands. Not really sure why that is. Late symptoms are just greater than 5 days, are very severe. Altered mental status, coma, swelling of the brain, respiratory issues, tissue death, to the point that sometimes people actually require amputation of fingers and toes and other things. And then multi-organ system damage, where your kidneys, your liver, and everything really shuts down. Rocky Mountain is not super common here, but we don't mess around with it. If there's a suspicion that somebody is in that early stage of Rocky Mountain, and we suspect a tick bite from a dog, we don't even have to suspect it, you live here, we suspect it all the time. We treat you for this. This is something we're really aggressive about because of how significant it can become. You can go to the next slide. So the rash, it's a spotted fever. This is the big one. 2 to 5 days after your symptom onset, you may have this rash that I'm going to show you pictures of. We see it in greater than 90% of patients, which is actually great because it really helps with our suspicion for this diagnosis. It can be flat or bumpy. It starts on the wrist and the ankles. It spreads to the trunk, and classically, it will probably spread to your palms of your hands and the soles of your feet. There are very few conditions that we look for in the ER that are on your palms and your soles, and it's a big red flag for something like Rocky Mountain. We don't like rashes on palms and soles. And then as it progresses, the rash becomes more what we call petechial, and what that means is you're actually having rupturing of little blood vessels under the skin. So they're like teeny tiny little bruises, but it's very indicative of very severe disease. Once we see that, you're in trouble and we need to get you on treatment and probably transfer you. Guess what the treatment is? Yeah, all right, thank goodness. I mean, we're in big trouble if doxy ever stops working. This is the classic rash. It's not subtle, right? There are other tick-borne illness rashes that are subtle. This is like, oh my goodness, I need to think about Rocky Mountain. And there's that classic involvement of the palms. Okay, tularemia. Dog ticks and lone star ticks are the typical form of transmission, but it can also be transmitted via inhalation. So landscapers that are mowing over rabbit warrens and things like that may be inhaling rabbit feces or even rabbit, like aerosolized particles of the rabbits themselves. It can also come from contact with infected carcasses and rabbits, particularly animals, particularly rabbits and hares, other rodents, or contaminated food and water. It's very, very virulent. And what's interesting, I don't know how many people know this, but it's currently classified as the highest level of a potential bioweapon in the United States because of how readily it can be transmitted. It can be, if you disseminate it in a way, it can be inhaled. It's not something we're terribly worried about, but it's interesting it's on the list because of how readily it spreads. It's also caused by a bacteria. I think it's the most beautiful bacteria name I've ever heard, Francisella. I don't know why, it's just beautiful. Incubation, sounds fancy. Incubation period is 3 to 5 days, but there's a broad range. You can go to the next one. The symptoms, this one also kind of has these non-specific symptoms, but there are specific syndromes that develop with tularemia. There's what's called an ulceroglandular form, where you get skin ulcers at the site of the bite, not always, and then lymph nodes that are swollen, very swollen around that area. There's a pneumonic form that involves the lungs, and that's patients that will come in with a non-productive cough, chest tightness, some shortness of breath, abnormal chest x-rays that aren't really classic for pneumonia, like you might see some swollen lymph nodes we shouldn't typically see, and they might have pain breathing. You can go on to the next one. There's an oculoglandular form that involves the eyes, light sensitivity, vision impairment or loss, sometimes conjunctivitis or redness and itching of the eyes, and then swollen lymph nodes in the head or neck. There's a form that involves the throat, resulting in severe throat pain the same way that strep or mono might, and you might have large tonsils with lots of pus and locally swollen lymph nodes. And then the typhoidal form is really just a blanket way of saying you have tularemia with one of those, without any of those localizing type syndromes. You might have some or all of those symptoms. It might be more vague. And those individuals, even without pulmonary symptoms or lung symptoms, might have an abnormal chest x-ray. Treatment, doxy. The tularemia outbreak that we had in 2000 on the island, there were 15 confirmed cases. 11 of them were the pulmonic form or the pneumonic form, and there was 1 death. So what's interesting to me, you can get pulmonary symptoms from tick bite, but I think a lot of those we had to really think about the dangers that our landscapers are in when they're out there mowing and not wearing masks. And it's so important to educate people whose jobs put them at high risk for tick bites, whether you're or just simply inhalation of this organism. All right, Powassan. So you guys know we had a case here recently. This was very upsetting. But at the same time, I think it's really important to point out that Powassan is actually probably very, very common, much more common than we think. The issue is that it's asymptomatic. Most patients are asymptomatic. They might never know they have disease, or if they do have the disease, it's very, very mild and it's self-limited. They may have cold symptoms, just feel kind of crappy for a couple of days, and then they feel better. So it really never rises to like our clinical attention. You might come in, if you come into the ER and you might feel like you have flu-like symptoms, we're not necessarily thinking Powassan. And we don't need to, because I think there's been a lot of question about we need to be testing more aggressively. We could test lots of people and they'd come back positive for Powassan. It doesn't mean anything. It doesn't change the treatment, and you're 99% likely to get better on your own. But this is a problem for people with a compromised immune system or a naive immune system. So babies, cancer patients, people that are older, or who are on drugs that suppress their immune system or have cancer. So it's concerning that this happens, but it's not something that we need to be alarmed about. We know it's here. So this one comes from the deer tick as well, and what's interesting about Powassan is that the time from the bite to the transmission can be as little as 15 minutes, and that's because this particular bacteria lives in the tick's salivary glands, not in its gut, so it doesn't need to be full, and it doesn't need to regurgitate as it gets back into you. So this is problematic, because finding a tick within 15 minutes of attachment is tough. It's caused by a virus, unlike all of these other diseases we've talked about. 1 to 5 week incubation period. In most people, like we said, this initial phase is really vague and people aren't sick. But weeks to months later, some people in those immune compromised states or for other reasons will develop neurologic issues that are very obvious. It is no longer vague. They will have inflammation around the brain and the tissue around the brain. They have altered mental status, prolonged high fever and confusion, decreased consciousness and seizures. They may have, there's like a classic syndrome where they have difficulty moving their eyes, or they have abnormal eye movements. And they have paralysis that's either what we call spastic or flaccid of the muscles. So this is not a vague presentation, and this is when we test for Powassan and go, oh my God, I need to think about this. Unfortunately, there's no treatment right now for this. This is a virus. Antivirals have not really been shown to be helpful. Supportive care is what we do and hope that patients recover. We treat their fever, we treat their pain, we treat muscle spasms, we hydrate them, and we hope that their body's immune system is basically able to mount enough of a response to clear the virus. The problem is that once you're at this stage, there's a pretty significant chance that some irreparable damage has been done, and that's the big thing with Powassan. Okay, we're almost done here. I think we're done. Are we done? One more? Oh yeah, so it's an emerging tick-borne disease. It's the only tick-borne flavivirus that is endemic to the United States. Like, it's kind of unique in that way. There were 397 cases of it from 2004 to 2024, according to the CDC. And then in Massachusetts, in that same time frame, 71 cases. This last case that we had this month is the second on the island in 20 years. So again, if we tested everybody, we might find more cases, but they're irrelevant in the sense that everybody's feeling fine and they're not getting sick. The cases are definitely rising, and we don't really know what's driving that, although I'm going to drop the term climate change. You can go to the next slide, and this is what shows, this is our graph here from CDC showing in 2004 the documented cases of Powassan and where we are in 2024 in the United States. Go ahead. Borrelia is the last one. So not a lot of people have heard of this disease. It's also caused by a tick bite or a deer tick bite. This one's unusual because it occurs within 24 hours of attachment, which is a problem because we're all worried about that 36-hour mark for Lyme disease. Long story short, take the tick off right away. Check every day. Caused by a bacteria, 14-day incubation period. Symptoms are very mild, also may never come to anyone's clinical attention and go away on their own. But in this case, the fever comes and goes, much like if you're familiar with malaria. Malaria kind of has this, I feel fine, I feel like crap, and the fever comes and goes. Borrelia will do that, the miyamotoi disease. And of course, more significant, as all of these things are in people that are immunocompromised, they might have more neurological symptoms, and the treatment is doxy. That's it. Oh crap, there's one more. Okay, guys, this one's interesting, and this is important. I put this in here. It causes a Lyme-like bullseye rash. So what's fascinating about this is that people will get a rash that looks just like this, and you might go, oh my God, I have Lyme disease. And it's often around the site of the tick bite. It's typically smaller than the Lyme rash, and it might have this little tiny, we call papule, right in the middle. It's often misdiagnosed as Lyme disease if somebody lives, like we do, in a place where there's both Lone Star and deer ticks. And it's presumed to be spread only by Lone Star. It's a syndrome of unknown cause. There's no diagnostic test. There's really no treatment that's warranted, but it causes a lot of confusion because people will go, this is a Lyme rash. And frankly, if we can't determine if you've had a tick bite that's by a Lone Star or a deer, we're just going to treat you. We're not going to mess around with the possibility that you might have Lyme. The symptoms, if you have any, are going to be very mild. But if you were to say to me, this rash occurred 3 days after I pulled a Lone Star tick right off of this bite, we're not going to treat you for Lyme disease. So it's a little bit confusing, and it's really important for you guys to do your best. I recommend you take the tick and you put it in a piece of tape when you bring it into us so we can help identify it. Okay, and now. Okay.
So I'm Ed Caldwell. I'm a otolaryngologist, ENT. I'm a otolaryngic allergist, so I'm an allergist as well. And if you have a sleep issue, I'm a sleep physician. We're not going to talk about sleep. We're going to talk about alpha-gal. Better? Okay. And so I'm not going to use slides because the slide deck is about 100 slides long, and we would be here till about noon, and no one else would talk, and we'll be able to find out veterinarians. But I want to take some takeaway points from my talk, and if we do that, as Jerry said, if we cure a couple people, we're way ahead of the game here. So what is alpha-gal? Alpha-gal is not an infectious disease. Aubrey already mentioned that. It's an allergy. Okay, we are inoculated and we become allergic to alpha-gal. And alpha-gal is a polysaccharide that exists in mammalian meat. All mammals, but not primates. So I could eat cherry and not have any issues. Okay, so if you're, yeah, you might. But so it's in beef, pork, lamb, venison. It can be in animal byproducts as well. And so that's the concern. It can be in medications occasionally, heparin. plasma expanders that we may use in an emergency situation that Aubrey may come across if someone's in a trauma situation. Big concern now moving forward is open heart surgery because there's a lot of medications, including heparin, that are used for that. This is a new disease, okay? This is a new disease. It's been identified in the early 2000s. It's been identified on this island over the past 5 years. It seems to be directly related to the expansion of the Lone Star tick population, which you're going to hear a lot about. And Patrick's going to give you lots of beautiful pictures. We've already seen some from Aubrey. So what the issue is with the Lone Star tick, it seems that transfer antigenicity to us. So it bites us, it inoculates us, and we become allergic to it. Now that Lone Star tick is the most dominant species on this island, I'm going to take a little issue with Aubrey. Alpha-gal sensitivity and syndrome is now the biggest problem on this island as far as the tick-borne illness, okay? Infectious diseases are important, there's no question, but the prevalence of this disease on this island is exponentially expanding. And so it's a real concern from a public health point of view to all of us, because there's probably now 30 to 40% of people are seroconverted, meaning you've been exposed, and if you do lab testing, you would be positive. We're going to talk about that a little bit more now in a second. So we know how we can get it. It seems to be from tick bites. So mitigation is going to be, we're going to get lots of that from Patrick. We've already heard about this. If you can avoid being inoculated, you won't get sensitized, which is good. So the natural history is, and I have personal experiences because I have alpha-gal, is you go out in the woods, you get bitten, you get inoculated, and you may have no symptoms. And so everybody who comes in here into the ER may say, well, I got bitten by a tick, I need to be tested for alpha-gal. No, you need to have symptoms. And so what are we concerned about? That's alpha-gal syndrome, okay? So you can be seroconverted, meaning you can have a positive test, but you don't have the syndrome. So the syndrome is an allergic disorder, and so it's an IgE-based disorder. All allergies are based primarily in that fashion. And once we've been inoculated, we produce IgE in our bloodstream, and that binds to cells in our body all over the place, whether it's in our skin, our gut, our lungs, our sinuses. And when we get re-exposed, we have symptoms. Alpha-gal is weird, okay? Most food sensitivities that I see in my allergy practice, people will have a shrimp, will have a lobster, they'll have peanuts, and they quickly develop symptoms within minutes, sometimes, generally not more than an hour. Alpha-gal, it's different. We have our beef, we go to bed, we wake up at 1:30 in the morning, our stomach's hurting, we got a rash, we're like, well, what the hell caused this? So it can be difficult to diagnose because of its proximity to the exposure. It can be hours later. So I want that to be a point to be taken out to everybody. But you will have symptoms. And so the classic allergic symptoms can range from rash, they can be lip swelling, which we call angioedema, tongue swelling. It can cause gastrointestinal distress, which is a very prevalent symptom with alpha-gal syndrome. And we think that's actually from swelling of the gut lining, which kind of sounds scary because it is. So you often get really cramping symptoms. You may feel nauseous, maybe barf, okay? That's what I had. I had never had, in my experience with my alpha-gal syndrome, I never had any rash. Okay, so the interesting thing about allergies in general is the presentation of your symptoms are going to be like you. You're an individual, okay? So it's sometimes difficult to apply this to a population. So I want you to understand that your symptoms may be not the same as your friend who had anaphylaxis. And that's the biggest fear. Everybody thinks they're going to get anaphylaxis from alpha-gal, being sensitized to it. And what's anaphylaxis? That's the severest form of an allergic reaction, okay? It usually involves at least two systems of our body. It can be rash, it can be lip swelling, it can be wheezing. In the full-blown anaphylaxis, when you're going to the emergency room, you usually tachycardia, you usually have low blood pressure, you're sweating, you get diaphoretic, you are dying, okay? Now, hopefully, you don't ever reach that stage. the number of people who have alpha-gal syndrome who have anaphylaxis is small. Okay, so there are lots of EpiPens being prescribed on this island. Okay, and I know because for other allergy patients who I have, they can't get them because they're out of stock. Okay, chondroids, last week, we got no EpiPens. You got to go to Stop and Shop. So it's a concern from a public health point that there's probably a lot of unnecessary EpiPens being prescribed. So if you test positive for alpha-gal, you have no symptoms, meaning no rash, no gastrointestinal upset, no lip swelling, never had any symptoms, you don't need an EpiPen. Okay, you're never going to use the EpiPen. You probably shouldn't have been tested. Okay, and that's the other message I want everybody to take home. If you have an exposure to a tick bite, you don't need to be tested unless you develop symptoms. And that's true for these infectious diseases, but also for this allergic abnormality, which is alpha-gal syndrome. So wide-ranging testing is not helpful, okay, and unnecessary, and probably not safe because of the lack of, that you may have an EpiPen and use it inappropriately. And if you've ever had epinephrine, it's an exciting ride, okay? You don't want to use it unnecessarily.
I feel like you're kind of making light of it, though.
I'm not making light, no.
Okay.
No, it's not to me. It's because this is the number one public health concern for ticks on this island. Yeah.
And as soon as you get hives and you're throwing
Exactly. If you develop symptoms, if you have a tick bite and you develop hives, gastrointestinal upset, and be vigilant that you have, you might be developing those symptoms, and then testing is necessary. So how do we test? It's a blood test. It's called a RAS test. It's going to have a scale of 0 to 6. Theoretically, the higher your number on that, the more antigen exposure possibly, but the higher levels of IgE in your bloodstream. Now, interestingly, once again, because alpha-gal is a weird allergy, I have people who are class 6 and eat cheeseburgers every day, okay? That's why testing does not necessarily mean you have the syndrome. Now, I have people who are class 2, okay, who have been to the emergency room repetitively in anaphylaxis. So it's not to be trifled with. I'm not belittling that. But we have to be very clear about, how we go about testing and evaluating it. So public information is really important about this particular syndrome. Okay, and so the mitigation, which you're going to get here back over and over again, is really important. If you go out to the beach and you go, hallelujah, I made it to the beach, I didn't get bit by Lone Star tick, right over Patrick's shoulder there. There she is on the beach, celebrating that she made it. This is, we need to protect ourselves, okay? I live in Shillmark. I have a farm. I hunt. I'm a hyper-exposed person, and I've gotten most of those tick diseases up there. And I'm pretty responsible about mitigation. But that's what I want everybody to know is you gotta mitigate. You gotta expect yourself if you've been out in the woods to prevent this from spreading.
What's the length of time between the bite and the onset of symptoms?
We don't know, okay? So, I could talk for hours about this, but the questions are good. So the question was, what's the time span between exposure and becoming positive? Because this is not an infectious disease, we don't really know what that might be. We do think, why it's probably more prevalent on Martha's Vineyard, is the number of inoculations that you get exposed. Okay, so one of the unique things of the Lone Star is the Tick-Borne, the larval exposures that we get, and I had several exposures to that, is you're getting 400 bites, okay, at a time. All of those are inoculations to the Lone Star saliva that's probably mimicking alpha-gal, okay? And so it's probably the number of exposures. And so unfortunately, as Patrick's going to emphasize, this is the dominant tick species on this island now, okay? And this is why this is becoming the dominant tick-related disease on this island. Because maybe 20 years ago, there weren't, Patrick wouldn't be able to document a Lone Star. Seemed to come in at the ends of the island and move to the middle, but it's all over the island now, so it's very difficult to control. But the problem with allergy is a bit science, a bit art, okay, and the way we evaluate it. We love to apply science and be very confident in our science about it, But this allergic response is not acting like a lot of allergies. So there's probably some what we call delayed allergy aspect, which is a cellular allergy symptom. It's cellular allergy. So if you've been bitten by the Lone Star, these bites last for weeks, sometimes months. We're not sure why that is. Okay. The allergen's gone probably, it's been cleared, but it seems to linger and linger and linger. And that's probably from the cellular response that comes in there. So that's another component that's being researched. There's a lot of research. So how do we treat? Main thing we do is mitigate the exposure. Now, once you get them exposed and you're sensitized, the next thing is to avoid the triggers. That's meat, okay? So primarily beef, pork, lamb, venison, and beef, deer. Dairy, about 20 to 30% of people with alpha-gal are positive to dairy. You can be tested separately for that with an IgE RAS test, okay? Not everybody who has alpha-gal has dairy sensitivity. If you are highly sensitive, then you become worried about these things like medications, gelatin, and these plasma expanders, and generally you're going to know if you're in that class because of your initial exposure. So in my experience, typically what you get as a symptom initially is going to be your symptom. It does not seem to escalate, but we don't know really absolute confidence of that because of our ongoing exposure to lots of Lone Star tick bites. So it always goes back, mitigate your exposure to Lone Star ticks. But if you can avoid exposure to the triggers, mammalian meat, you will be asymptomatic, you'll be fine. So there's no medication for this that's generally very effective, okay? Antihistamines can be helpful, but for gut, for instance, really the only effective thing that's being looked into now is a medication called chromium sodium. It's a membrane stabilizer for mast cells and other cells that have all the triggers for allergy. You have to take it 4 times a day, okay? So it's very chromium sodium. So it's called gastrochrome, right? Gastrochrome. There's investigations now into biologics that remove components of allergy, and one of them is called Solet. It's an anti-IgE medication, and that's an injection that's done every 2 weeks, and it's not a cure; it's a treatment. You have to do it as long as you're positive and sensitized. So it's going to be an interesting road ahead as we try to fight this as a public health issue. We're in good hands because we have really motivated young people here looking into this. Aubrey, Leah, and Patrick. And so there's going to stay tuned for updates on this.
Quick,
Should we start the question and answer system there?
can I do a quick introduction?
Yeah.
You just said, just so long as we keep away from mammalian products, we'll be fine, like meat and things like that.
Yeah.
So, hi, my name's Sue Dunbar, alpha-gal, 3 weeks ago diagnosed. I felt very on my own. I was told that by the hospital as well. Just stay away from meat and products, and pork products happen to be in every hygiene article you might use on your body. Just recently, the New York Times article, in talking to Prudy Athern, the nutritionist, someone at a barbecue, inhaling meat fumes being cooked, went into anaphylactic shock. I'm not trying to cause horror or terror, but it's real. Like, this is a real allergy. We're not just turning vegan because it's something cool to do, or we do care about animals, but however, this is life or death. Bottled water that is filtered with bone char. White sugar is filtered.
Can I interrupt you just for a second?
Yes.
If we're talking to the extremes, and that's concerning.
People do need to know this, though.
Right,
If
but-
we're sent home from the hospital with no support
No,
group
that's-
information
I agree
and
with
just
you.
being told to avoid mammalian products, I was on my own for 3 weeks and I was terrified. No one told me I would be allergic to my cat's saliva because my cat drank out of my water glass. Like, it's real. Vomiting profusely for a long time, having nasal allergies for a long time. I just feel like we can do better than this. Don't
Well,
just tell people to avoid mammalian products.
No, there's a
Please.
laundry list of it, and that's where I would just ask people, if you have alpha-gal, educate yourself. It's extremely important. But be careful about the internet. Okay, there's a lot of inaccurate information on there. one of the good resources for alpha-gal information is alphagalinformation.org. Okay, not .com. The .com has been usurped by crazy people. But .org is curated, and they consult with Dr. Cummins, who is the world expert on alpha-gal, and it will be updated regularly, and it has very good information. It has a lot of information about these more esoteric type of exposures that you can possibly get symptoms from. The list is very long, and some of it can be, it has to be researched to find out. We know that alpha-gal can exist in a lot of these byproducts, and you have to be careful. That's why I say if you have a high level of sensitivity, you have anaphylactoid reactions, you are the person who has to be super vigilant. You can't probably go out to eat, okay, because you cannot control how your food is prepared. You have to be careful, going to your friend's house and letting them prepare. You're in a special subclass, and I would absolutely agree with you. You just have to be hyper vigilant then.
So Ed, we're going to have to move
Yeah.
along in the schedule. This section's gone a little bit longer than we anticipated.
Sure.
But do you have any last final comments, and then maybe afterward?
Well, I think, I would encourage everybody to become educated about it. If you think you've been exposed and you have symptoms, get tested, okay? If you have vague gastrointestinal upset, you haven't been able to figure it out, you have a rash of unknown origin, and you live on this island, you should be tested for that. If you're symptomatic, get tested. Thank you.
There's one more question. Yes, please.
What if you're allergic to doxy?
Yeah, so for all of those, I could have made that slide presentation like 3 hours long. There's so much more nuance to treatment of tick-borne illness and diagnosis, which we can get into, and how you read test results and who gets tested, and we can talk about that when we do some questions. But when it comes to treatment, so what I presented to you is the mainstay of treatment for these diseases. There are multiple alternatives for people who have allergies or sensitivities to doxycycline. Some of them are as effective as doxycycline, some of them are not as effective. We just tend to go to doxy first because we don't want to use our more sensitive drugs and create resistance, but there are alternatives for all of them. Yeah, absolutely. I'm glad you asked that question.
Okay, thanks, Aubrey and Ed, for your amazingly informative. Now, I have the privilege now to introduce my colleagues at Martha's Vineyard Medicine, Kelly Ellsworth. We're going to have a little panel, maybe we'll field some questions here. Kathleen Kohler. And Dr. Bill Skidas, who joined our clinic a couple of years ago, and he's just been fabulous too. So I'd like to just say that we're on the front lines approaching the dilemmas of tick-borne illnesses. So we're usually the first people to run across people who complain of various things. I'm going to ask Bill Skidas, first of all, he's been practicing on the island for a number of years. If he's seen any difference in the way people are in the presentation of tick-borne illness. Any general comments you want to make?
I think in general, there's no question. I think everyone's aware of it, that the prevalence of all the different types of tick-borne diseases seems to have, incredibly increased, especially over the last, few years. Alpha-gal is a typical example of that. Back in the day when we first got here, I don't know that we didn't know enough about it to diagnose it, but we didn't really have much in the way of symptomatic tick bite related symptoms of the gastrointestinal tract. But maybe Kathleen can speak more to that. But I'm not aware that we had such a problem. And then in the last 5 years or so, it's just exploded. So that's one real manifestation that just wasn't here before. I think most people do come on a early basis to get evaluated, which is very important because, not one of the things that hasn't been said yet is that not all ticks transmit disease. Not all tick bites, transmit disease. So there's a real issue of not over-treating or underdiagnosing. So one of the things we try to tell patients is, what Aubrey referred to before, is that a tick needs to be on you and embedded for a certain period of time. It's not just something you pick up in the morning and you see later on, I've got a tick bite, I need to take medication. That's not the case, and that increases the risk of potentially, as with any antibiotic, potentially having increased resistance, in addition to, of course, the possible side effects of any medication, including antibiotics, which could include gastrointestinal symptoms, changing of the gastrointestinal microbiome or the environment of our normally good and friendly bacteria, and also, rashes to sun exposure. So I think it's important for us all to understand that not every tick bite needs to be necessarily treated, but if there's ever any question, certainly medical advice should be sought or you should be evaluated. In addition to that, I know there was it was already referred to, there's a whole big outbreak of tularemia roughly about 20 years ago, which seemed to be the new rampant disease, and that seems to have quieted down to some degree, but it looks like we're seeing it more often as well. And more often, sometimes again with very non-specific symptoms and basically a positive blood test. Very important to treat these illnesses because undiagnosed or untreated, they can lead to significant morbidity and even fatality in many cases. So it's important to not ignore symptoms that might be related to something that, even if you didn't get a tick bite, even if you don't have a rash, evaluations need to be done to just prevent the possibility of a prolonged period of illness that just goes undiagnosed and untreated and potentially has severe sequelae clinically. And of course, Lyme disease and Lyme arthritis has always been with us, and it's rampant, and we're recognizing it, we're getting seen for it, but that's essentially what
I want to mention a few years ago when I was working at our clinic, the woman who was handling our front desk told a story that had happened to her, and this sort of emphasizes the number of ticks that are on each deer. Her husband is a hunter, and he brought the dead deer down into their basement, hung it up to render it. And when the temperature of the deer body got to a certain point, all the ticks dropped off at one moment. And she said it was like iron filings hitting the cement. You could hear how many there were. A pile, that big. That's how many each deer has. So if anybody out there is a hunter, be my guest. They're also a problem because you get into car accidents. I bagged 3 deer myself unintentionally. Nothing against Angel's auto body, but I think, you may be employing some of these guys to try to have a little humor here if we can, but it's a fact that every one of these deer has amazing amounts of ticks aboard, and they're going to come after you. So watch out. Kathleen, any comments about?
I think that one of the things that addressed was just the common sense day-to-day management. And if you have any kind of a fever during the summertime, that's a really important symptom. When you have your tick kit with your tick removal, with tweezers and your little card to identify your ticks, part of it should also be a thermometer in there. So many times people come in and go, I think I had a fever. I don't know. I usually have chills. I think I had a fever, but I need the data. So that makes a big difference to me whether or not I'm going to do a full tick panel looking for all the other tick-borne diseases. Hello?
Does holding on to the tick have any value? So I've heard keep the tick, there might be a way to discern if there's something in that tick.
We use the testing service at UMass, which is very good. It's developed, they test for all the tick-borne illnesses. It's really a good question of whether or not it's necessary to test ticks. And maybe we can talk about that later. Sam is going to be up here shortly to talk about the variety of topics, but he says, as I remember from the past, it's not necessary most of the time to test the ticks, but we can go into that separately. There is a service we can get. There are a bunch of commercial ones, but UMass is probably the closest and easiest to use.
But getting back to the practicality of it, I mean, I think in the clinic, we see people coming in with a tick and saying, I have a tick bite, I need to be tested for everything right now, and don't want to leave the clinic until they've had a full tick count. If you saw all the data that Aubrey presented to you, that there is an incubation period that's up to 2 weeks before the tick count can oftentimes turn positive. It's not going to be positive right after your tick bite. It's kind of pointless to be testing for it immediately. We're testing for symptoms primarily, and again realizing that a lot of times people have a local reaction to the tick bite, which is small. It's going to be maybe an inch in diameter or so, and raised in erythematous, oftentimes itchy. Lots of times you know you have a tick bite because of that, and that's not an EM rash. Those rashes occur later. So again and again, we're going to be saying that that you don't need to be tested right away. There's going to be a delay in testing. But then when we do that, we're going to be making a decision largely on our pun intended, our gut reaction to whether or not you have it. Because the testing right now is so overloaded. When we this is part of my reality testing talk here. When we send we send patients over to the hospital, we'll get a preliminary back on the Lyme, just like a screening, with oftentimes that day or within a day. But the full tick panel, including the Western blot and everything else, is going to take, on average, Aubrey, you can tell me, but 5 to 7 days.
3 to 7 days, and the alpha-gal is also included that it takes time.
It takes time, and so that we're going to be probably making decisions based on your symptoms, including and doing things preemptively before that.
Mm-hmm.
So, yes, Betsy.
And the testing is not always accurate. Testing is
Correct.
troublesome and can give a false negative or false positive.
That's correct. One of another issue here is that all these many years later, what we're testing are antibody tests, and the antibody tests reflect exposure. That many people it's hard to live on Martha's Vineyard and not have had an exposure to the Lyme disease before, full-blown Lyme disease. So the testing may still be persistently positive, and that we don't have real-time testing like we do for COVID, like PCR testing. It's probably to me, it's one of the mysteries of the universe. Why when COVID occurred, within 6 to 8 weeks, we had real-time PCR testing. Lyme disease has been around now for 50 years or more, and we're still relying on antibody testing, which makes it so much more deductive than based on real an actual infection. So there's that.
One comment I'd like to make, again referring to this woman who's praising the sunrise or whatever she's doing.
Yeah.
She's in the questioning position, and last night I was eating dinner with Isobel Renai, who's going to speak with us. there's a reason why ticks have this questing position. Their sensory organ is in what we could consider their wrists. And they're waiting for somebody warm to come by, and then they jump, and then they go after them. So that's probably pretty appropriate, and that's about the kind of grass that a tick would be on. Who knows, there may be thousands of ticks in this grass. They're ubiquitous, as I'm trying to get the point across. So Kelly Ellsworth has a brief presentation about how tick-borne disease can manifest in people with dark complexions. You want to take it up?
Hi, everybody. Thank you. First of all, before I get started, I wanted to just take the temperature of the room and ask if you could share how many of you are here today are medical professionals. Could you raise your hand, please? Oh, good. How many of you have ever had a tick disease before? How many of you, according to Dr. Caldwell's definition, have tested positive for alpha-gal and also have symptoms? Wow. Okay, thank you so much for sharing that. So what I'm going to address is tick disease among people with darker complexions. Could you move through, please? And I also want to preface my talk by saying, in honor of all of you in this event, yesterday I was diagnosed with Lyme and started treatment yesterday. First time I've ever had Lyme in my 60 summers on this island, as far as I know. So I did that for you. So if I have a little bit of brain fog, that's why. So how I got started on this topic is years ago when I was training to be an EMT, I took a class, and the textbook was about 500 pages, full of pictures. And the real emphasis was on how, when you're an EMT, how much you use a patient's appearance to very quickly figure out what's wrong with them. You scan them before you even approach them to get a sense of what's wrong. And a lot of the things we look at in the medical field in general, and EMT specifically, is the skin. And so there are a couple of terms that they use. Erythema. Erythema is a fancy way of saying red or pink skin. And you use erythema as a sign of cellulitis, which is a deep infection below the skin, an abscess, necrotizing fasciitis, which can be very scary, angioedema, which has to do with infection of the blood vessels. Another thing we look for is pallor. Pallor means paleness. That can give us a sign of anemia or shock or circulatory disorders. Rashes, which we've been talking about today, hives, angioedema, drug reactions, things that measles, which will be a topic a lot. And then another thing is, and all these are affected by skin color. So, and a third thing that's affected by skin color is pulse oximetry, which is the little thing that they stick on your finger to measure how much oxygen you have. These ways that we look at medicine can be really problematic with people with darker complexions. And they don't need to be, but they are. And when I was taking that EMT class, there were hundreds and hundreds and hundreds of pictures in the textbooks of what these things look like on skin. The only picture of a person with a dark complexion was a picture of a sore of someone with syphilis. No other pictures. So what does Lyme look like in someone with darker complexion? That's the question. Next slide, please. It's harder to find the EM rash, the bullseye rash, on a person with darker complexion, and most of us in the medical field and in the community are not as educated about what that looks like. What happens as a result, there was a study done by Dr. Dan Lee of UCLA. 34% of Black patients are diagnosed late in the process. We miss the rash, versus 9% of white patients. Next slide, please. This is just a graph of the distribution. The African Americans are the orange color and white people are the blue color. As you can see, African Americans are 3 times as likely to get the neurological symptoms. Why is that? Because they're diagnosed late. Next slide, please. So there was also a study that was in the Journal in JAMA in 2023. African Americans have nearly 5 times the odds of disseminated disease compared to those who have the identified EM rash. As Aubrey Ryan told us, the disseminated disease is when it gets bad. They tend to have a longer duration time to diagnosis, 35 days on average. 35 days. Let that sink in. They're also more likely to be started on an inappropriate antibiotic, often some sort of skin manifestation. People think that it's a skin infection and they're given a different antibiotic. They're not given doxycycline, so that's time wasted. Next slide, please. These are the charts from that report. The white people are the darkest color, and black people are the second darkest. And so you can see that African Americans have the lowest diagnosis of EM rash, but they are much more likely to end up with the disseminated rash. And their symptoms, which is the second graph, they're far more likely to have neurologic symptoms or arthritis because, in my opinion, of this late diagnosis. Next slide, please. So here are some examples of the EM rash on darker complected folks. And let's just have a moment to just look at that. Really not typical of the EM rash. Not what we think of it. And no red skin, no pink skin. But you can see variations in the skin. And so, you're looking for darker skin, lighter skin, not red or pink. Next slide, please. And here's another example. And next slide, please. And next slide. Now, I want to give you a little anecdote. We had this recent case of a tiny little baby with Powassan. I happened to be acquainted with somebody who a couple of years ago, who's African American, older gentleman. He was a couple of years ago having dramatic seizures and other symptoms, and they could not figure out what was wrong with him. And the seizures have decreased at this point, but he is suffering from a lot of the results of seizure after seizure after seizure after seizure. I don't know whether he had Powassan or not, but I wonder. And I wonder whether the color of his skin played a role in that. I don't know. And next slide, please. So how does this implicate us? Taking a closer look. The people that are at highest risks are hikers, landscapers, gardeners, people who work the trails. You all who live here year-round may have noticed that a lot of our gardeners and landscapers are from Jamaica or they're from Brazil. They have that darker complexion, and I really worry. I really worry about how many people are going undiagnosed and untreated, and how this is going to impact them in the long, long term. So I think it's really important that we educate the people who own these landscaping companies, so that they can educate their staff and make sure that they're on the lookout for these tick-borne diseases. Another problem is community awareness. So within these communities, I've heard African American people say, I didn't know that Black people could get tick disease. There was a time where African Americans were less likely to want to go hiking. There were reasons for that. People didn't feel safe in the woods. There are crazy people in the woods. On this island, that's different. I know there are a lot of African American visitors who love hiking and really spend a lot of time out there in the trails. And I think a lot of folks don't know that this is a big, big danger. Another problem can be barriers to outreach. Language. How much of our tick information is translated for the Brazilian population. Community access, just how often do people who know about tick disease and Lyme disease have interaction with these different communities, and then the short duration of stay. I'm sure a lot of us have friends who came to visit and they went home and they ended up having tick disease and their local provider didn't know anything about tick disease. They didn't test for it, they didn't know about it. And so if people are coming in shortly, they don't know that this is a risk for them. They go home and they might not get the treatment that they need or the testing that they need. And then lastly, what I hope is the smallest factor of this is medical bias and assumptions. But that's part of why I'm here and why I'm so glad there's so many of you here that are medical professionals. It's just, we've got to be on the lookout. We cannot ever assume that somebody with darker complexion does not have tick disease. That could have big consequences. Thank you.
Would you advocate for periodic screening for people whose professions continually expose them?
I think anyone who's having symptoms should get screened, but especially, I mean, I think that anyone who's, gardening and landscaping, if you're having flu-like symptoms, if you're having, any kind of tick symptoms, it makes sense to come in and get screened.
Will there ever be something for gardeners that could go in and just get tested without having to have a doctor's appointment first? Would there ever be a chance that there was, if they had symptoms, if you could give them a lab test?
I know that our practice owner is working with, our new practice owner, Jeff Levy, is working with employers about having, about paying for the care of their employees. So this would be something to explore. I think that's a good idea. Yes?
I would skip the employers. I would talk directly with those people who are working on the landscapes.
And I live on Jackie, so we obviously have tick problems there. When I talk with the landscapers who are out in the field, chances are they have within, during the summertime, have had flu-like conditions. And I use that as kind of the metric when I'm trying to talk with people about whether they possibly have any tick-borne diseases. And I think for all of us, we all have an opportunity to engage with those folks who are actively helping out on landscaping, doing a number of different things with regards to the landscape. We should talk with them.
Your point's really well taken. And I think a couple years ago when we were doing the Lyme disease study, the Pfizer vaccine study, and we were trying to do outreach to that population. The best way to do that is actually through the churches, and maybe we need to go back and revisit that.
Talk into
Talk to the mic. Okay.
you said churches is a good way to approach people.
I just wanted to thank you for raising the issue of people with darker skin. Both of my kids are biracial. The younger one has chronic Lyme and was diagnosed 2 years after the first symptom. And I wanted to add to your list on implications, maybe summer programs for kids, Felix Neck, Farm Institute, places like that. I don't know if she could have been exposed in Pennsylvania. It turns out they're a hotspot too, but I think to educate those providers, because I really had no idea. She's 27, it was when she was 10 that she had her first symptom. So, thank you so much.
Aubrey has a question.
I simply wanted to say, I have a lot of patients that come into the ER who work in landscaping or work outdoors otherwise. A lot of them are from Brazil, and the number of them that have absolutely no idea about tick-borne illness, many of them who have come recently, the ones who have been here for a while are aware more so. But I do think the concept of reaching out to employers as a group and preparing information in Portuguese or in English as well for these high-risk professions is really critical. And the disparity in the information distribution is huge. To live here as a landscaper and not be aware, to be looking for ticks and the symptoms of tick-borne illness is awful. I do think there's some information on the Martha's Vineyard Board of Health page that might be available in Portuguese, but letting people know where to find that information is the problem. It's been sitting there. So I think that kind of outreach is really critical here, and we're missing a huge portion of the population who's suffering these conditions and don't even know that they need to go in and get help.
Thank you.
Okay, one more question. John, in the back.
Thank you all very much indeed for this and for everything else you're doing. 20 years ago, Rick Carney produced the Island Blue Pages to deal with the grotesque problems of pollution facing island waters. This was printed in English. Several years later, Brett Stearns wonderfully got support from the tribe to have this produced in Brazilian Portuguese. This was for federal funding. I'm wondering about the level of support for this issue. It's wonderful that Martha's Vineyard Medical is doing this, and this is occurring under your auspices. But where is the rest of the island boards of health, the towns, the Martha's Vineyard Commission, the Martha's Vineyard Hospital, with respect to funding and support for all of this, for the production of clear information, for the dissemination of the information in English as well as Brazilian Portuguese, and whatever else is necessary, and for efforts in community outreach to direct people to the information?
Thank you so much. And I when I was asking who's here, I forgot to ask if you're willing to identify yourself, if anyone's here from the government, from anyone, any government officials here at all.
Any ICE agents?
Thank you.
Not funny. Okay, well, I want to thank our panel members, and we got to move on to.
No one answered his question. His question was, where are all these other
Oh, you're right.
organizations at with?
Well, I think we were wondering if anybody here has that information. Yeah, Aubrey.
Okay, I can answer. I can only speak to things I know about, but Leah Hamner at the Martha's Vineyard Board of Health has been amazing. She was going to be here today, but she's traveling. The work that's being done by the BOH and collecting data and making sure information is getting out there is amazing. Go visit their webpage. There's a bunch of stuff on there, but there's a whole tick-borne illness outreach page and data that's there. Patrick and I and Leah have been doing lots of talks at Still Point, which was just a really nice venue to have these sort of discussions. We've done one on alpha-gal. We have done one on Lyme disease. Patrick just did one on backyard tick control. Leah did one on tick bite prevention. And within all of those discussions are resources that we're giving out about where to go to get this information. I think the problem is really one of dissemination. We need to have a more centralized approach and not all these little siloed approaches to how we handle this. And I think we need to talk more to the media here, the hospital where I work but don't represent, as far as like the talks that I'm giving. There is some talk about putting information on the website because there isn't any, and that would also be available in both English and Portuguese. And then at the hospital, the other thing that I've done, we have these templated discharge instructions for various conditions. You have appendicitis, I can give you this information on appendicitis. There's a paucity of that when it comes to tick-borne illness. There is some, but it's not nuanced and it's not local to the vineyard. And certainly there was no information on alpha-gal. So I did create instructions going to alpha-gal info and talking with Scott Commons and Ed to create discharge instructions so that if you are seen at the hospital and tested for alpha-gal, the goal, and this is newish, my feeling is if you're being tested for alpha-gal, you should be given this information about what to expect if your test is positive. If you're not getting that, ask. Say, can you please make sure you give me some information about this? They can send it through the gateway because a lot of times those test results come back later, but you can say, hey, can you please send me this information? It is unfortunate that, we're still in a position where patients, and I'm a patient, not just a clinician, we have to advocate for ourselves, so ask those questions. And the more you ask, and if you're an employer or an owner of a landscape company, go to the public health office and say, hey, I need this information. The more pressure we put, the more information we'll get out there. But we're really trying to close those gaps as far as like people really not having access to it. I hope that helps answer your question a little bit to the best of my ability.
The libraries host Zoom talks with people.
Yes, the library does. I think there was one in Katama recently I didn't even know about. Still Point, we did one at Chilmark Community. I know Jeff and Martha's Vineyard Medical are going to be doing a lot more tick-related things, and that's really a primary goal of theirs is to make this information very accessible and make sure that you guys are having the questions answered that you need answered. Sorry? Cell phones? Oh, you mean like in terms of social media and things like that? Oh, absolutely. I agree with that. Yeah.
Yes, I was just gonna say to that, I mean, it's not gonna help our tourism, but we may be at the point now. I mean, there's really only 3 points of access to this island: the air, the ferries, and then those people who have yachts.
The New York Times article,
And
the
if
New York Times article already did us all in for like our property value.
Yeah, so it may make sense to, you know, I mean, the towns may decide, the Board of Health may decide that everybody who gets off a plane, everybody who gets off a ferry gets a flyer, so that they're informed and the flyer is English on one side and Portuguese on the other. That would
I think Richard wants to add.
Hi, I'm Dick Johnson. I used to be the director of the Tick program before Patrick. We had a volunteer who spent a tremendous amount of time working with the steamship trying to allow us to get posters on it. And they said no. What they did allow us to do is to print up some brochures, and they used to sit right at the ticket desk as you came off of Woods Hole. They said if we had 25,000 of them, they'd let us put them on the boat. As with most of these problems, everything everybody's talking about, it's time and money. If somebody wants to, if you want to volunteer, you want to spend some time, one of the best things we do is have somebody go back to the steamship or a group of people or pressure them. Until we've cloned Patrick into 10 people, it's the people and it's the people in this room. You've got to take some responsibility. You've got to say, how can I help? And one of the things you could do is go to the steamship and say, or your local elected officials and say, you need to get involved in this, you need to get something on the steamship. If they get no pressure, they'll do it.
I wanted to mention one other thing that Martha's Vineyard Medical is doing, and I believe the hospital and Island Healthcare are too, but I'm not sure, which is we're involved in a new chronic Lyme disease study, which is being run out of Tufts and Mass General. And so anyone who has an EM rash, a bullseye rash, if you come to see any of the participants in the study, you have the option of having a skin biopsy and participating in the study. There's a little bit of a stipend that you're given for that. But I'm really excited that we're doing this. I know that the medical establishment doesn't have a lot to say about chronic Lyme, but I know on this island, people have a lot to say about chronic Lyme, and I'm really proud that we're participating in this study.
One more question, then we'll have to move on.
Audrey, could you please repeat the website you were referencing?
The question was, what website were you referencing? We
For
couldn't get it.
Yeah, so alphagelinfo.org.
alphagelinformation.org.
If you just Google Alphagel information, you'll see this website.
Not just Alpha-Gal, but boy, did you say something about a broader website?
Oh, MVDOH, thank you. Yeah, the Martha's Vineyard Board of Health. If you just Google Martha's Vineyard Board of Health ticks, it'll pop right up. It's on.
I'm going to repeat it just for the video. MVDOH. That's the Martha's Vineyard Board of Health.
Well, thank you, my colleagues, and we're going to clear the stage to present Patrick Reynolds. And Paul Elias to talk a little bit about prevention. By the way, if you're interested in the various aspects of tick-borne illnesses, the tick cycles, they're well documented and presented with short little videos that were done a couple years ago. But it's very different. They put a lot of money into doing this. So the Department of Public Health, you'll see a lot of stuff on their website. Okay, who goes first? Patrick Reynolds.
Hi everybody, so my name is Patrick. I am a public health biologist, or more colloquially, the tick guy for the island. I'm a Dukes County employee working for the boards of health under a public health grant, the Inter-Island Public Health Excellence Grant. So I think I'm just going to give a little background before I get into prevention. Apparently, this is a state-funded grant. 250 groups across Massachusetts are receiving some state funding to give public health or local boards of health more funding and more resources. So this is kind of touching on what the last question that was just asked. I exist, and this job exists, and this resource that we are providing exists because of the health agents. They are the ones that fought for me and fought for a tick biology position. And actually, I get pulled in so many different directions, always wanting to go, people are asking for me to go on the Cape and do other talks all over the place. So this is something that's needed. And there's other extension agents, like I believe Plymouth County has a entomologist on staff that can also kind of talk to some of these tick problems and tick issues. But we are trying, and that's, again, like Dick had mentioned, like it takes time and money to kind of build that capacity and that effort so we can really, truly educate the community. So I'll just jump straight into personal protection. I give lots of these talks. My business card is on the back table. I have lots of information I can talk about with ticks. I could, like as mentioned before, I could drone on for 3 hours just on this topic alone. So if you feel like you're missing something, I'm here year-round, full-time, so you can grab a business card off the back of the table. My emails are up here. My main email through the county is biologist@dukescounty.org. And then through the tick program, or through my job as the public health biologist, we have the Martha's Vineyard Tick Program, which has been a grassroots effort since 2011. And that email is more of like a public-facing email, and we have a yard survey program. So if you'd like to have a private consultation with me at your home during the main tick season, you can reach out to mvticks@gmail.com and contact me. Those emails are open for any tick-related questions, but I can share slides. So, because I truly believe that prevention is some of the most important things when it comes to the whole tick concerns. So we'll jump right into it. By and far, wearing permethrin-treated clothing is the #1 thing you can do for tick prevention. I've got, I think, 8 tips here listed for tick prevention or disease prevention. The first 3 are really the only ones that prevent bites. And these are the ones that I focus on. I think my greatest testament is I've been here for 4 years doing this job. I hunt, I hike, I fish, I visit at least 100 properties a summer, and I visit trails regularly throughout the summer season for work. I've been bitten twice in the last 4 years. Both of those bites came this past June, and it was my own fault because I was not listening to my own advice. And I'll show you exactly which tip I wasn't listening to. So I was wearing permethrin-treated clothing, and by and far, this is what I trust to do in my job. This is how I can do my job comfortably. You want to treat from the ground up. Sometimes having just the bottom half treated, but if you want full protection, you want shoes, socks, pants, and shirt. And I'll get into that, why that's kind of a hard sell. And that's like the worst part of permethrin-treated clothing is you need to cover up and cover exposed skin. The idea is to keep the ticks on the treated clothing and off your skin. What I've read about permethrin is that after a minute of exposure, any ticks are dead. 90% of ticks are dead an hour later. So it has an outright toxic effect on it, and it's a neurotoxin for the ticks, and it paralyzes them. And as far as I've read, it's completely safe for us, and there's really no adverse health effects when used as directed. The biggest thing about permethrin is it's only for treating clothing. It's not for use directly on your skin. But permethrin is long-lasting, so there's multiple ways you can treat your clothing. You can buy bottles of permethrin locally. I've seen it at SPS, Brickman's, Basics, Shirley's Hardware, some of the other hardware stores around. It'll be sold anywhere you find bug spray or bug repellents. It's just you want to read the active ingredient and make sure you're getting permethrin, and there'll be instructions on the back of the bottle on how to use it. So you can buy bottles locally and treat your own clothing, your own shoes, your own outdoor gear, and that, once it's dried, so you don't really spray your clothing as you wear it, you just set it out on the ground, hang it in the garage or something, spray it till it's damp, and then let it dry for 2 to 4 hours. Once it's dried, those home applications will be effective to wear for 6 weeks or 6 washings. So it even lasts through the laundry. And that's what I have at home to do all my footwear. And I just set a reminder on the calendar on my phone to just remind me to retreat every 6 weeks, which I put about 40 days. to give me a couple extra days to remember to actually do it, because that's one of the hard parts about tick prevention is it causes it requires a little bit of a behavior change, and sometimes it can feel like a chore, so it can be hard to kind of include it into your routine. But I would say, like, with these tick prevention tips, I live pretty comfortably on this island, and I kind of do what I want when I want outdoors, as long as I'm dressed appropriately. Outside of the DIY, doing your own clothing treatment, there's a company called Insect Shield where you can buy brand new pre-treated clothing from their online store, or, which I highly recommend, you can take the clothing you already own, mail it to them, and have it professionally treated for about $9 a garment. We have a discount code with Insect Shield. They've actually been a good partner to us for trying to spread awareness on the benefits or the effectiveness of permethrin and trying to help us get more permethrin into the hands of folks here. So we have a discount code, which you can take a picture of the flyer on the back display table, but it's Martha's V 2025 for 15% off at Insect Shield. I highly recommend. That's what I do with all my work clothing. I have bottles of permethrin at home that I spray shoes with, and I can touch up other clothing that I need to, especially like during hunting season for some bulky clothes that I don't want to mail off. But all my work clothing, all my recreation and hiking clothing, I just mail it to Insect Shield because they treat it, and their treatment lasts 70 washings. So it lasts all year long, and I think that's a huge benefit, and it's really fairly priced for $9 a garment. So I usually send my clothing off in February, March when I don't need it as much, and I'll send anywhere from 3 outfits, 9 garments. And this past March, I sent 15 garments to be treated, and the total cost was like $115, which I think is so fair for the effectiveness it is protecting you against the ticks here. Next slide. So these are kind of the examples of what you would see of permethrin in the store. On the left-hand side, all those bottles, those are what you're going to treat your own clothing with. The nice thing about permethrin is it's all a standard 0.5% concentration. So to me, it doesn't really matter what brand you buy. It's all the same permethrin. Just make sure you're not buying permethrin and confusing with some other repellents that I'll have on the next slide. The yellow bottle, go backwards, please, thanks. The yellow bottle of the Sawyer permethrin. Yeah, the yellow square bottle, that's the typical one that I buy because I think you get the most fluid ounces per price. But in the end, different brands, doesn't matter. I think I've seen the Repel brand or Coleman brand sold locally here. Those are the DIY treatments. On the other side are like the professional treated and the wearable items like Insect Shield clothing, and you'll hear a lot more from Paul about TikToks, which he's modeling for us today. And again, in the next slide, I'll get to why these are important. And if I was wearing something like this, I wouldn't have had the 2 exposures I would have had this year. And I would have continued to say that, I've been here 4 years and I've had 0 tick bites, even as outdoorsy as a person that I am. So there's wearable items, and typically anything you buy pre-treated comes with Insect Shield treatment or that long-lasting 70 wash cycle treatment. Next slide. So tip number 2, and this is the hard sell. This is the tough one to convince people to do in summertime, is you want to cover up as much as possible and cover as much exposed skin and tuck the clothing in. And that's why I got bit, because I wasn't tucking my pants in. And that's kind of what the togs are designed, but I won't get into it too much. I'll let Paul explain. But I was wearing a full permethrin treated outfit when I got bit. I was not tucked in at my pant legs, and I was off trail in the brush in the middle of June. I got bit on Father's Day this year. I was asking for it. And I kind of laugh about it because I'm here, teaching people to, prevent bites, and I'm not listening to my own advice. So obvious on the left is what we typically see in the summertime. We've already referenced this painting over on the wall. And it's like typically people are in open-toed shoes wearing shorts, which kind of exposes them depending on where you go. You'll see I'm wearing shorts today. This is probably the 5th time I've worn shorts this summer, which is the trade-off I make and the sacrifice I make. And that's why covering up and tucking your clothing in can be a hard sell, because it's 85 degrees and 90% humidity here. But I talk to plenty of people that are they don't hike anymore, they don't garden anymore, they really just don't go outside anymore out of fear. And I want to at least give you a little hope and optimism that if you dress appropriately with a full treated outfit, I feel comfortable going where I want, doing what I want. I'll walk through chest-high grass this time of year during my surveys, and I'll just keep my hands up in the air because those are the only exposed parts of my body. Ticks getting all over my treated clothing, but usually after 30 seconds or a minute or two of exposure, they're either falling off or they're having enough effect where they can't really crawl and walk anymore. So the middle slide, obviously, a little bit better is closed-toe shoes and taller socks. Still has some exposed skin on the legs, but generally more covered up. And if you're doing any type of heavy outdoor work or hiking, obviously you want to dress on the look what the character on the right looks like. Shoes, socks, long pants, long sleeve, and all tucked in. And if you want to make these, you kind of want to use your clothing as a barrier and just permethrin treat it for like the ultimate tick preventative. Next. So again, you kind of want to use clothing as a protective barrier. Tucking your shirt tail and pants is just keep the ticks on the clothing and off the skin. And like I said, if I was following that rule of tucking in, I wouldn't have been exposed in June like I was. Both were Lone Star ticks that bit me. I got bit on Father's Day, and a week later, different ticks. And I was like, all right, I'm not messing around anymore because I might have gotten a little lax over the years with my tick preventative because I just haven't been getting bites. But I learned my lesson this year, and I've gone back to tucking in or using some of these wearables to cover up. But there's things like tick tape. I've seen it at SBS that you can, it's double-sided tape that you can use on the outside of your clothing to trap them and stick them to something. And there's a company called Rhino Skin, which they market clothing as bug bite proof. I just like, it's not treated in any way, so for folks that it might be adverse to permethrin or some of these other repellents, they do make clothing that is not treated. But in the end, I don't really think ticks have the ability to bite through clothing like a mosquito would. So if anything, just regular clothing would work if it's not treated. But having the treatment on there, sometimes I like to have the tick crawling around on my treated clothing because I know it's doomed. Next slide. So number 3, which is again, these are the bite prevention, is use effective repellents. And I'm always going to recommend EPA registered repellents. The most common are going to be DEET and picaridin. I don't have much personal experience with picaridin or picaridin, but I've heard people say, because DEET is a little greasy and oily, it's kind of gross to use sometimes. That's what I have in the back of my truck. In the end, I don't really use much DEET when I have a full treated outfit. Picaridin, I've heard, goes a little bit drier, a little bit smooth, so it's sometimes nicer to use. But you want to use an EPA registered product because they are proven effective, and we know how long they've been effective for. So there's a tool called the EPA Find the Right Repellent tool for you. So you can go through and search, and it'll bring up a spreadsheet of all the different products. There's probably 500 different DEET products with DEET on the market. Some of the other listed registered repellents, they're not as common. You're not likely to find them in the store here. But again, they have been tested for efficacy against ticks and mosquitoes, and they have been tested for human safety. And repellents have their place where they're more convenient to use. They can go directly on exposed skin, and that's the biggest benefit to them. So it's a good mixture of things where I have repellents and permethrin at home. Like the repellents can be used by the back or set by the back door for your guests and visitors. You can spray yourself as you're walking out. I've talked to people that exclusively use DEET as their tick protection here, and they never really used permethrin clothing. And again, the repellents can go directly on exposed skin. What makes me nervous sometimes, I have a lot of people saying, oh, permethrin, I've been using that every day on my skin. I was like, that is not how it's supposed to be used. That is not what the instructions say on the back of the bottle. They go and grab the bottle of repellent they actually been using. It ends up being picaridin or picaridin. So they're just, again, they're confusing that active ingredient. So that little image on the slide, or the middle, when you're shopping for repellents or permethrin, cover up the label on the bottle and read that active ingredient, which will be in fine print on like the bottom left or right hand side of the product. That's what you're making a decision on. Most labels are going to say it's safe and effective. So just look for the active ingredient.
Because I think what most people don't recognize is I think the DEET only lasts a couple of hours.
It depends on the formulation. So if you use that EPA tool and type in DEET, it'll bring up a long spreadsheet. And What I've seen is DEET will be rated effective anywhere from 2 to 10 hours depending on the formulation. And again, that's why I'm such a big permethrin promoter, because last 70 washings are much, much longer once you apply it. But again, DEET is still my choice of repellent. Next. Yes, so you want to use these products because it might be really hard to see on this picture, but I've got a blown up image on the back of the table. This is courtesy of Sam Telford from Tuckernuck Island, I believe. And it's hard to see, but each little individual dark splotch is an individual tick bomb on his leg. So he's probably got 10,000 little tick larvae crawling on his pant leg right now. And notice how he stopped and took a picture. He didn't set his leg on fire. He didn't take off his pants and go running through the field. He stopped and took a picture because it's really interesting. This is one of the worst pictures I've seen for a tick bomb on one person. I would guarantee that his socks, his shoes, his pants were all treated. That's why he feels protected. And I guarantee you 5 minutes after that picture was taken, all those tick larvae had rained off him and fell off him, and it had the effect of the permethrin. And even if the tick doesn't immediately fall off or want to get off the permethrin, again, after a couple of minutes of exposure, you know the tick is doomed and it'll start to have paralyzing effects. So next slide. So you want to use, again, so here's another great example of Sam self-demonstrating on himself for the sake of public health. It's, again, hard to see. So he went out larvae sampling, and the tick larvae are so small that they can crawl between the fibers of a sock. And so you'll see on his left leg, he was wearing an untreated sock. It's covered in bites. It's got at least a dozen bites around his ankle, even though he's wearing probably tall crew sock. On the right leg, not a single bite on his right ankle because he was wearing a permethrin-treated sock. Because again, the ticks, after a minute or two of exposure, they should be paralyzed, not able to bite, and certainly not able to stay attached and feed. Next. Oh, that's supposed to be an animation. This is a slide of doing a tick check. And I was going to end it with just saying, just do it. Sponsored by Nike. You don't really need to see the slide. It was just tick prevention number 4 is doing daily tick checks. You've probably heard it all your life. Obviously, a tick check may not prevent the bite, but to me, tick checks are the best disease prevention tip. Because like it's mentioned earlier, not all ticks transmit something, and the ones that are carrying something, it's often based on how long that tick was attached. So the sooner you get it off, and the more regular you do your tick checks, it kind of sets a baseline when you've been exposed, and it's better information. So doing regular tick checks, you have to do a whole body scan. There's obviously zones around the groin and lower extremities and around the armpits and scalp that are kind of hot spots, but I just essentially named the whole body there. So you want to check all over. I use a handheld mirror in front of my bathroom mirror and a headlamp or extra light during my tick checks. You'd be amazed how extra light helps with a tick check. And I actually appreciated Kelly's presentation about tick-borne disease and darker complexions, because I feel like that plays into tick checks as well. I don't have many pictures of the ticks today, but I'm concerned about Lone Star ticks because I feel like they match more my complexion. They match the skin tone of my freckles, my moles, and other things. So I think a Lone Star tick might kind of blend in a little bit better versus a deer tick, which is to me jet black. And anytime I get a little jet black dot on my skin, it really stands out easily to me. But that might be a different case for folks that are darker skinned. But again, using a magnified mirror or some type of mirror to check around the legs, the groin, those hard to see places, and then having extra light can really help. Tip number 5 is if you're thinking or if you're worried about ticks that might be on your clothing after outdoor activities and you don't want to trap them into the house, you can take them off and throw them straight in the dryer on high heat for 15 minutes. That'll kill any ticks. And that's a really good tip during larvae season where they can really get embedded in the clothing. I've had people concerned that they were having ticks in their sheets and other upholstery items. So if that ever the case, you can take them off the bed, kind of skip the washer first, put them straight in the dryer on high heat for 15 minutes. Ticks are really sensitive of drying out. So if I'm worried of having ticks on my clothing, I'll throw them in the dryer. But in the reality, for me, in the 10-15 minutes it takes me to drive back to the office or back home from my field site, my field work, any tick that's on my clothing is going to be dead. because I'm wearing all treated clothing. I've gotten home and had dead ticks hung up in the fibers of my clothing because their legs curl in, they turn dry and crusty, and then they just get hung up in the loose fibers. But again, that's kind of like a backup plan where if you're worried about stuff on the clothing or on fabrics, throw them in the dryer. If you don't have access to dryer, even just hanging the clothing outside in a sunny location can cause the ticks to kind of want to move away. Again, they can be sensitive to like direct sunlight and warmer temperatures. And sometimes you can almost treat like clothing as like contaminated items. Like you want to keep them outside just to make sure that any ticks on there, you're not bringing them into the house, and now we have ticks on the bed, on the couch, or crawling across the laundry. Next. So as mentioned already today, but have a tick kit. Have one to go, ready to go, in the car or in the house. But for me, a tick kit would include something sticky like a lint roller or tape, clear packaging tape, and you can use that to fold the tick, trap the tick and suffocate it if you're trying to, keep a hold of it. But a lint roller can be really good if you encounter some of those tick bombs before they bite. I always get the question if like the lint roller will remove an attached tick. As I understand, when the ticks bite, they excrete a cement and they're literally gluing themselves to the host. So I don't think a lint roller is going to remove an attached tick. That's why we need tweezers. But a lint roller is great for tick bombs. Or I've talked to people that will lint roll their kids or their pets that come inside from like immediately after coming outdoors just to see if they can get any tick that might be crawling on the skin. But obviously you want to have tweezers at home, fine tip tweezers. I don't want to talk about removing ticks with matches, petroleum jellies, essential oils, or going for a swim for an hour. Just get that tick off as soon as possible. The longer it is on, the longer or the more elevated your risk becomes. And then again, a magnifying glass, I feel like that is almost just as important as having tweezers. A lot of folks that don't look at ticks all the time, like apologists, it's hard to identify a tick, especially with their size. So I think a magnifying glass and being able to ID the tick can be just as important as having tweezers to remove the tick. And again, a handheld mirror to help with those tick checks. I had a good tip. A resident said that, you can buy like a 10x magnified mirror from like the makeup aisle, and that can hopefully help make the ticks easier to see. Next. Last couple slides here. So this was brought up earlier. This is a great program hosted by University of Rhode Island called Tick Spotters, and it's a free tick identification service. So if you get a bite and you want to know what kind of tick it is, you can take a picture of it, mail it or email it to them through their website for free, and I think their policy is to respond within 24 hours. They'll ID the tick, ID the life stage, and give you a brief risk assessment based on the engorgement status of the tick. And like Aubrey had mentioned, some of the tick-borne diseases are unique to the tick. So if you know you're bit by a deer tick, you know there's concern for Lyme, there's no concern for alpha that we know of, and vice versa. If you get bit by a Lone Star dog tick, no concern for Lyme. So IDing the tick that bit you can be important information for your doctor. Next slide. And then the last kind of thing is you can elevate that to the next level and you can pathogen test the tick. So this question was brought up. We always recommend tickreport.com. They make that data publicly available for local boards of health. This is not our first recommendation with what to do after a tick bite, and the biggest thing is if you test a tick and it comes back positive, it still really means nothing about your health. Sometimes information can be power, and I still kind of share the service with folks. And I've had lots of folks say that, they sent the tick off and I came back negative, and that gave them a little bit of peace of mind. But even then, you still need to monitor for any flu-like weird symptoms that may arise. I think Dick shared a story with me that's saying he had a close friend, got a tick bite, sent it off to get tested, tick came back negative, they started getting flu-like symptoms 2 to 3 weeks later, and they were going back and forth with the doctor trying to figure out what it was because the person kept saying, it's not tick-borne disease, the tick I tested was negative. Turned out they had Lyme the whole time, and they just delayed their treatment and diagnosis by a couple weeks. So again, information can be power, and sometimes it can be helpful. Last slide. And then those are just, again, reiterating all the points. If you want to take a quick picture of that, we have the discount code with Insect Shield for 15% off, and then I'll let Paul talk about his tick togs and some of the other wearable items.
Next slide. Good morning, I'm Paul Elias. Let's see. That's not mine. Oh, you doing slides? Okay. Right here.
While we're waiting, I got a pair of these TikToks and I use them for cutting the grass. They're great. You don't need to feel much wrong. So yeah, so and there'll be, all the slides will be on our website and Martha's Vineyard Medicine. And the med.org. Any questions you want to pose while we're waiting for this technical thing? Yes?
I think the question might be for Aubrey. I was diagnosed almost exactly a year ago with alpha-gal and Rocky Mountain at the same time.
And I think she mentioned in her talk that the Rocky Mountain was only from the deer ticks. Ooh, is that correct, or did I mishear you?
Rocky Mountain is from the dog tick.
Dog tick?
Yeah.
Okay.
So, are you asking like how can I have a little reason?
Could it be a false positive on the Rocky Mountain?
You can have a false positive with Rocky Mountain. Sorry. Okay. You can have a false positive with Rocky Mountain, but I mean it really depends on your symptoms, right? Like if you, for me to test you for Rocky Mountain, I have to have a very high threshold for like high suspicion for Rocky Mountain, right? I don't randomly test, it's not usually included in my tick panel, but it sort of depends on what my suspicions are. You can have false positives, absolutely, with Rocky, but I don't know what your specific syndrome spectrum was. Hives and itching. So that's alpha-gal. That's your alpha-gal. Now, I think the problem with alpha-gal, and I do experience this here, is people are like, well, I've never had a tick bite in my life. And I'm like, you live here. You probably did. You might have missed it. So in that case, if somebody could say, I know I had a tick by a dog tick, and I now have Rocky Mountain, how the heck do I have alpha-gal? The answer is, you got it from a Lone Star, most likely, got it from a Lone Star tick bite you didn't know about. Does that help clarify?
Sam, you want to comment? This is Dr. Sam Telford, one of the world's experts on ticks.
So I'm actually skeptical that Rocky Mountain spotted fever is being diagnosed here, classic Rocky Mountain spotted fever. There is a rickettsia amblyommatis, in 30 to 40% of the Lone Star ticks here that we suspect causes an atypical spotless fever that cross-reacts with Rocky Mountain spotted fever testing.
For a false positive?
But we need to actually get the smoking gun, which is a blood sample from one of these patients who come in with a fever and you suspect spotted fever. We need to isolate the organism to say rickettsia amblyommatis causes disease. But it's entirely possible that the alpha-gal and the rickettsiosis was transmitted simultaneously by the Lone Star tick.
That other rickettsiosis?
Yes, that's correct.
So, this is actually great to know because these are the kind of research studies I think we should be doing here, and I would love to. I'll collaborate with you, dude. No, I was just talking to the hospital about like how we can get involved more in these studies, and I know that if we said to our patient population, hey, we're doing a tick research study, are you interested? Right? So I think there's a lot of discussion to be had about exactly that. So we should talk more. But that would be really interesting to find out that it's a different rickettsia species that's causing that.
I'm glad to hear that. I've noticed since I've been practicing of this, the Rocky Mountain spotted fever test will come back positive in a person who may be over 50, is a gardener, has vague, almost subclinical syndromes. And sure enough, they get positive rickettsia tests. And it's not in the textbook that I've ever read. It's sort of, we probably should try to get a series of these going. Yes?
Me?
You, yes.
Hi, Dr. Jerry. You wait for the microphone so we hear.
Hi, this is for Patrick. When you came over and tested my property, we had like everything there. So I've been doing the Cape Cod mosquito and tick spraying on my property. I'm still getting a ton of ticks. Any better way to spray other than the Cape Cod mosquito and tick? They're doing the organic one that doesn't really hopefully kill everything, like the bees and everything like that, because you don't want to do that. But in your experience, what is your favorite preventative for the property itself?
Spraying is a double-edged sword, just inherently. When I do the yard surveys, spraying the yard has always been my last resort effort. I always want to build the foundation of personal protection first, and then just general landscaping and maintenance throughout the yard, like raking. I could get into it, but to me, there's two broad options. You either spray the organic route, which questionable if it's been effective. I think a lot of those products haven't really been tested stringently. Or you go the synthetic route, which is similar to the permethrin that I wear on the clothing. The reason I don't willy-nilly recommend properties to spray that is because permethrin has a toxic effect to all insects and other pollinators that it comes into contact with, and it's also toxic to aquatic life. So, and it can, yes, that's a point too, it can be toxic for cats or have a sensitivity to it. So in the context of like wearing on our clothes, I practically live in the stuff and I feel safe wearing it. But it's a much more nuanced talk or kind of answer when it's trying to spraying in the yard. But I'll talk afterwards with you a little bit. I think Paul is.
Before you say that, this whole myth that organics don't, the myth that organics don't kill other things is BS. There is no spray that is specific to ticks. If they're spraying, even the organic stuff is killing whatever it lands on. So do not let them tell you that it's not harmless to other organisms. It is. The biggest danger is when they spray for mosquitoes. When they spray for ticks, they should be doing a 5-foot perimeter around your yard, around your house. They're not spraying up in the air. It's when they spray up in the air for mosquitoes that you start killing bees and pollinators and things like that. A good applicator can use permethrin, not within 100 feet of wetland, and in ways go around the plants, go around the flowering plants, that has a minimal impact. It will kill whatever it lands on, but so will the organics.
Paul, you ready to go?
Yeah.
You waited long enough.
That's fine.
Thank you.
He did a good job for me. So there are 5 towns on Martha's Vineyard, and I'm from the 6th town in Dukes County, which is the Elizabeth Islands, Gosnold. We're next door neighbors, and we are very similar ecologically to the Vineyard, different in some respects, but we have been living with ticks and tick-borne diseases just as long as you have. Next slide. I'm a recovering herpetologist, like many of us here. People who are herpetologists are groveling around in the tick brush all day, every day. Sam is one of these people. There are others in the crowd. You don't have to identify yourself. But I spent my college years finding and naming new species of tropical salamanders. This is Bolita glossa-jacksoni from Guatemala. Next slide. Naushon, this is our biggest road. We don't have any pavement to hide from ticks. We have no vehicles. We walk, and so as soon as we step out of our door, we're in tick country. Next slide. Many of the roads are like that, or a foot deep. Next. 10 years ago, when Lone Star ticks were quite new, I stepped into a bunch of them, and those are my feet. I itched for 2 months, and I decided I was going to protect myself, but I was still going to do herpetology, so I needed some protection. Next slide. Can you run this as a movie? No. Okay, a week ago on Agatina Island, attached to Naushon, I took a flag out and a flannel pillowcase and ran it through the grass, and I came up with one of these tick bombs of newborn Lone Star ticks. And it's just a surging mass of tiny ticks, and you can see that's a flannel pillowcase. That you don't see the holes in that, but but they're the same size as those ticks, and ticks can go through normal fabrics. Next. So this is a close-up showing these newborn ticks with only 6 legs. They develop 8 legs at their next molt. And many of you have, that's when Sam's pant leg was covered with these. Next. I chair a small foundation associated with Nashon, and we funded this study 15 years ago, tick bite prevention with permethrin-treated summer weight clothing. This is from Tom Mather's lab at URI. And what he was able to show was that permethrin-treated clothing really was effective, that it killed ticks, and that the ticks that actually bit people after passing over clothing were almost always dead within 2 hours, even if they were attached. So they were presumably not transmitting lots of things. He also demonstrated here the importance of the very lowest part of the leg, the foot and ankle, being where especially deer ticks approach people because they need that humidity, they're down low, and you get them on your feet and then they crawl upwards. Next slide. Soon after I got bitten by all those little ticks, I went to India and we went for a hike in the Ghat Mountains. And in Asia, in the highlands, you don't get ticks when you walk through the bushes, you get leeches. This is a tiger leech, and it's very active questing, and it inchworms along very quickly, and there's a lot of these on the bushes in India. Next slide. These are leech socks that are sold to keep the leeches off your feet. You get to the end of your hike, you shake out your shoes, and there's all these leeches, frustrated and hungry, that haven't been able to get at your foot. So I thought, okay, this is the kind of thing that would have spared me all those bites. So I came back to the United States and I began looking at fabrics. Next slide. So these are TikToks. They're what I'm wearing here. They have a strap. They cover up my foot. And I looked for a very long time to find the right fabric for these, something that was very tightly woven, that no tick larva could get through, that would accept permethrin treatment. We did a folded down top so that a climbing tick is stuck under there and is poisoned by the permethrin. Sometimes when people wear these with shorts, they kind of tuck it up to get a better look, which is okay, but it does do some reduction in the effectiveness. If it's got a nice cottony feel, it's very breathable. It dries instantly. It's very quick drying tech fabric. And it doesn't feel tight in your clothing. It's very, very thin, so you can put it on with essentially any garments you got on, except maybe flip-flops with a thong between the toes. They're quite tough for how light they are, and so this was really the right stuff. I've been producing these for 10 years at Nashon, sewing them in my cellar while I wasn't doing finance in the daytime. And it's all one big extended family there, so these are all my cousins. I have a certain kind of responsibility as a board member. So I was producing up to, I don't know, this summer we probably produced 200 pairs for Nashon. And eventually I backed away, I stepped down from my kind of legal and financial responsibilities for the island. And I therefore ramped up my TikTok production. So I went to Fall River, found a sewing factory, and made up 1,000 of each size, small, medium, and large. And so I now have inventory. I started a Shopify site a month ago. And so we're trying to, because people have been asking about these, and we haven't been able to supply anybody because we just didn't have enough. So TikToks.com, there's the name, is the website. And I got some postcards with a QR code, and I even have some TikToks if you want to buy a pair. But I think they're useful, and it's something I'm interested in helping people with. I don't think I'll ever break even, but that's not the point. So that's, let's see, next slide. Okay, here's my wife, Marie, very stylishly wearing her pair of TikToks. So this doesn't have to be a fashion disaster. Next slide. And this finally is, I was sitting with a cousin of mine on Nashon the other day talking about this stuff, and this katydid landed on her knee, and I took a picture of it. And this is just the power of self-protection. To spray your entire environment and kill animals like that is really a shame. And to protect oneself is so much more effective and so much more useful. So thank you.
I can testify that you don't even feel the TikToks after you put them on. They're great garments. Congratulations. Wish you success. Okay, so I think it's now time to introduce Jake Tadaldi, who's a veterinarian. Step up and let us know about the veterinary aspects of tick-borne illnesses.
Before Jake starts, I'm in the back of the room. I just wanted to say quickly at Martha's Vineyard Medical, we bought about 100 of these from these TikToks, and we didn't want to get into retail, but we have a bunch at the office. And if you want to come by our office and make a donation, because we spent about $2,000 buying these, we're happy to give you a pair. You can decide. We're open Monday and Tuesday from 8 to 6, from Wednesday 8 to 8, Thursday, Friday 8 to 6, and Saturday morning. So anytime. Sorry.
Okay. Jake, you're on.
Everyone hear me? Good. Hey, I'm Jake. We guys lived for a while. So, I've been a veterinarian since 1990. Graduated from Tufts Veterinary School at that point. Have loved Martha's Vineyard since before I graduated from vet school. My wife and I have been coming here for that entire time. We purchased the property here 20 years ago, and we've loved it ever since. Now I'm scared to death to be here after all these talks. But I've been familiar with the tick problem for ages. I've been dealing with it with dogs primarily, cats as well, but mostly dogs. As many of you know about cats, they're very fastidious groomers, so they don't suffer from tick bites as often as dogs. However, there's still potential victims. For dogs, not surprisingly, they suffer from the same diseases that we do. Almost all of them. We don't worry about Crohn, although I guess that's possible. Tularemia, sure. Some of the other viruses, not so much, but we do deal with Lyme, Anaplasma, and Ehrlichia quite frequently. We have the benefit of looking at these things from a slightly different perspective. We don't find the worry in dogs because they don't know about tick-borne illnesses, but we do see symptoms, and we do see the ticks attached to them. And the interesting thing about ticks is that they are able to secrete a numbing substance or an analgesic when they attach, and so they go undetected by the pets and often undetected by people. The advantage to that is that when you find a tick on your pet, you can dig away and get that tick out without it really affecting the pet. So the animals don't get upset with you for removing them, and that's quite important to reduce the transfer of disease. The other thing that I noticed during these talks is that most people, when they find a tick, they think that's it. I've got the tick off, everything's good. But no, it doesn't mean that that's the only tick, and it also doesn't mean that it's the only tick that your pet has been exposed to. If you find a tick and you send it in and it's free of disease, that doesn't mean your animal hasn't been bitten by many other ticks in the past, and if it's been bitten by one, sure as hell been bitten by many others. So it's something to be aggressive about in detection. We have the benefit in the veterinary world of having ELISA tests that we can do on site. And I'm assuming that at some point those will be available readily in human clinics as well. But we can test within 8 minutes and find out if your dog or cat has been exposed to any of those tick-borne illnesses, Lyme, Ehrlichia, or Anaplasma. And it's become part of the routine blood testing for dogs in particular as part of the heartworm testing. So most of you have dogs, and how many of you have dogs? Okay, cats? You know one. So anyway, you're used to having your dog heartworm tested. Well, at the same time, it only takes 3 drops of blood. You can do that test, and 8 minutes later, you know whether your dog has had an exposure to one of those 3 tick-borne illnesses. And then you can decide, with your vet's advice, whether to treat or not treat. I favor treating because long-term effects of any of those tick-borne illnesses can result in very serious medical issues with your dog. Renal failure, brain fog was described earlier, but canine cognitive disorders. There are a whole bunch of things that happen as a sequela to having these organisms traveling around your bloodstream. So I favor being more aggressive. And again, doxycycline is a treatment of choice. I think anyone who has dogs, particularly dogs that spend any time outside, should have a backlog of doxycycline. Now, I was talking to one of my colleagues here just moments ago. One of the things we do as veterinarians in terms of treating dogs with doxycycline, many of them don't handle it well, particularly at high doses, and we generally go with high doses. So for a dog that's 50 pounds or more, I'll go with 200 milligrams of doxycycline twice a day for a month. And many of them don't handle that gastrointestinally. So what we do is we freeze the capsules or tablets before we feed them to them. That masks the flavor and masks the scent, as well as allowing that medication to get past the stomach into the duodenum before it completely dissolves. So the chance of gastric upset and regurgitation is minimized. And that's done with many veterinary medications. I'm actually surprised that humans haven't found that as well. I'm sorry. I'm not used to this, it's new to me. So you make the diagnosis, you treat your pets, and I'm always in favor of treating rather than waiting around to see if symptoms will occur. So that's pretty much similar to human medication. Go with the doxycycline. If you find, and this is often the human perspective and not necessarily the dog's perspective, but humans will tell me, my dog can't tolerate doxycycline. So have you given doxycycline to your dog? Well, not really. Okay, well maybe you don't tolerate doxycycline, but in that case, maybe we can start with amoxicillin, we can start with another medication, or we can start with a lower dose and work our way up to it. There are a bunch of ways around this, and so it's important to be able to talk to your vet. And I know on the Vineyard that has become a difficult thing because veterinarians are few and far between, and they're very difficult to contact. And so with that in mind, I'll be opening practice within the next 12 months, and it will start maybe as it'll start probably as a telemedicine consulting practice and then move on to house calls, which is what I do in Boston, and have been doing that for over 35 years. It still remains fun, and every day is a different challenge for me, so I still enjoy doing it. And it's an adventure every day, from doing surgeries on people's kitchen floors to treating medically and to diagnosing Lyme and Ehrlichia and anaplasma. So, having said all that, one of my focuses with my clients, and I always say to people, if I'm at a dinner party, I'm either the one you want to sit really close to or really far away from, because the conversation is going to get dark pretty quickly. We're going to be talking about bowel movements and vomit and anal sacs and tick-borne illnesses, and it's going to get scary, but it's fun. So, with that in mind, we heard about how many ticks are carried by deer. Well, what about dogs? Dogs are like inviting a deer into your house every day if your dog is out in the wild. Dogs are very attracted to ticks, and they have lots of blood, so ticks are very attracted to them and will feed off them regularly. So what you want to do is protect your pet, and if you're not using an oral preventive and or a topical preventive and or a Seresto collar, you're crazy. You're just inviting ticks into your house on a regular basis. So prevention is very critical. So next slide, please. So in 2000, which was 10 years after I graduated from vet school, the options for tick prevention were pretty simple. You had Frontline, which is a topical liquid that everyone tells you just put it all between the shoulder blades and you're all set. I tend to divide it between the shoulder blades and the hips, so it spreads out a little more quickly and gets absorbed more rapidly. Revolution, another spot on, which is an ivermectin derivative, and that's very effective against fleas and ticks and mosquitoes. Preventic, a collar that is worn with Amitraz, another pesticide, and then TCVP collars. These are organophosphates, a little bit more treacherous in terms of reaction. And all of these were pretty effective. In addition, permethrins and pyrethrins were used as topicals on pets, and they often resulted in skin scalding or hair loss, and it was awful when people would come in afterwards and they go on steroids or on all sorts of treatments for these problems, but they were happy that they didn't have ticks and fleas to deal with. And then for cats, it was either Frontline or a TCP collar, or organophosphate collar. So the next slide. Once we got to 2015, the numbers expanded, maybe along with the tick populations, but we had more options available and more ingredients to worry about. And so it became a little more confusing, and you can see it on the face on the veterinarian that he's got more advice to deliver, and the owners are interested, but they're just listening and they're probably not registering any of what he's talking about. So then, next slide. Now we have all these, and you can see even the pets are upset. We have lots of options. And what I tell people is, look, you've got all these options available to you. Do the research, find out what you think is going to work for you. Your application technique, your pet's receptivity to medication, your relationship with your pet. Decide whether you want to go with an oral tablet like Simparica Trio, which is a one-stop shopping. People feel, okay, we give this pill every month, our pets are going to be free of fleas and ticks and anything else that we have to worry about, no heartburn, no nothing. However, different products have different kill times, and the important thing with ticks is you want to get them dead before they have a chance to disseminate any disease. So the faster the kill, the better. You also have to worry about whether your pet will tolerate that particular medication. So some pets don't. Some pets who have seizure disorders are likely to have seizures after some of these medications, either the collars or the oral tablets. So you have to shop around and be ready to change if your pet has an adverse reaction. So I generally tell people, use an oral tablet once a month for most of them, or once every 3 months for Prevosti. Prevosti is one that people like because they can use it seasonally. But it depends on how your calendar works. If you're not a person who's going to remember every 3 months to deliver it, then maybe every month is better. But I like the oral tablets because they ensure that if a tick tries to feed off your pet, it's going to die before it has a chance to disseminate any disease. In addition, I like to add a Seresto collar, because the Seresto collar or any of the topicals like Frontline act as deterrents to ticks. So they do have chemotaxis, the ability to decipher that an animal is carrying a pesticide, and they'll stay away from that pet. So that's a benefit to you because they're less likely to carry those ticks into your environment and then infect you. So I like that combination. Not every pet tolerates them. So this message is mostly to tell you that no system or combination of medications is perfect for every pet. So you've got to figure out what's going to be what kind. Next slide. So this is the confusion. You've got all of these products available, and then next slide. This is the products and the ingredients, and so you're going to be faced with names that you're not familiar with, and even if some of the ones that were mentioned earlier by Patrick are confusing, this is confusing. So this is the time when you talk to your vet, say what's going to be best for my pet, and then talk to them about what your lifestyle is like, what your pet's comings and goings are like, and how you can best protect your pet as a way of, yes, protecting it, but also protecting yourself. Questions?
When you live on the island, can you stop these medications during the winter? Is there ever an off season?
No, absolutely not. That you know as well as I that the temperature doesn't stay below 30 degrees year round here. So with ticks, they don't die and go through a new life cycle every season. They're just around and they're dormant. But once you get up above 40 degrees, you're fair game. They're going to be hungry. And you've got more than one life cycle or stage to deal with. So you've got larvae, you've got nymphs, you've got adults. And they all need to feed at some point. So don't worry about the fluctuations in their life cycle. Worry about your own preservation. Back. Yeah. Go ahead.
Hi. Do they now have an active vaccine for dogs? I know years ago, I think from Jerry, I got a Lyme vaccine. I think that was '94, and they quickly discontinued that. But do they not actively now have a vaccine for dogs?
Yes, the Lyme vaccine for dogs has been available for a long time. I don't remember exactly when it was started, but it hasn't been discontinued like the human vaccine was, because there's always been a market for it, and there haven't been as many adverse reactions in dogs as there have been in people. So there's been an effective Lyme disease vaccine for, I think, over 30 years, and it remains effective. And there are many of them. all the manufacturers, the major vaccine manufacturers carry a Lyme vaccine. Some of them are based on protein, some of them are synthesized, but they're all very effective, and I use them every day.
I wonder whether you have any observations with regards to what happens when a dog that's been tick-borne comes into our house. That my experience is that it's the same thing. If the dog got into a skunk, the tick-borne becomes part of the house very quickly. Do you have anything that you might suggest to help out on those situations, especially since the first time it rains within the vineyard over the next week or two? That's when the tick-bornes are going to occur.
Right, so I haven't had a case of that myself, but I've heard about many of them, and I would suggest immediately using some of those tape methods. So roll a lint roller across your pet, get rid of as many of them as you can. Use permethrin, you can spray them directly, not on the dog, but you get them off. And you can also spray the dog and then get it off right away, because you've got to kill those things and get rid of them. And the other advantage to tick lifestyle, shall we say, is they can't survive off a host in hot weather or direct sunlight for very long. So they dry out. They rely on moisture. So if you get them off and get them dried out, you're okay.
So in my experience, what I've done is I've done a very light spray on the rugs. And I've also, whenever a dog comes in, I have a room that we check the dog in.
Brilliant.
Before it goes back into the house and gets onto the bed or the couch or whatever it might be.
Well, the only other thing you need to do is put in a private shower for the dog. But, I mean, showering them is wonderful. The other thing that two things, these old wives' tales that people still believe, is one, that if you find a tick on your dog and you don't have the stomach for removing it with tweezers, you should cover it in Vaseline and suffocate it. Do not do that, because the tick will struggle and secrete more material into your pet, and that would be devastating. So don't do that. Get the tick off. The other is that people believe that if their dog has a double coat, like say a husky or a Newfoundland, that the ticks can't get down to their skin. Sure, it's tougher for them, but they're industrious little buggers. They'll get there. So don't assume that your tick is immune because it's got a double coat.
I think we've got one more question, and we've got to move on. Go ahead.
Can you talk a little bit about the use of permethrin in the context of cats, and in particular as to the permethrin-treated clothing?
Sure. The permethrin treated clothing is maybe less dangerous than even considering exposing your cat to a permethrin medication, shall we say. So never put permethrin directly on a cat. They don't handle it well, and they can get very sick. As far as exposure to your clothing, as long as your clothing has been treated appropriately and it's dried, the chance for your cat to have an adverse reaction is minimized, but it's not eliminated entirely. So I would be very cautious about cats and permethrin. It's not a great combination.
Can you repeat that question?
The question was, what if your permethrin treated clothing then becomes damp? I think it's more possible for it to be transmitted to the cat that way, so I would be cautious if you're out in the rain and you happen to need to pick up your cat, remove the clothing first. And I have a sense of humor about this with my clients, because I always say I'm a licensed veterinarian and an unlicensed therapist, because people ask me questions. I mean, I probably get more questions than some of the doctors in this room about tick-related illnesses and their problems. And so I encourage people to get naked as often as possible. I mean, if you have a partner, get naked with them and examine each other. I mean, every night, my wife tells me, come look at me. And I know it's a trick, but get to examine each other to make sure that there are no ticks. And the larval stages are really difficult to identify. You really need that magnifying glass that we spoke about earlier.
I had a couple from Quebec who came in, and the gentleman had, he was a Mercedes mechanic. He had Lyme disease, and they said, well, doctor, what can we do to prevent this Lyme disease? And I said, well, you should examine each other carefully, all parts of your body. Are you married? And they said, yes. I said, oh, that's too bad, I'm sorry. The man laughed, the woman didn't laugh. Anyways, so, but enough foolishness. Jake, thank you very much. We have a couple.
I'm wondering about the difference between dogs and cats. Is this based on a more physiological difference between dogs and cats, or behavioral? Is it because of what you refer to as the fastidious grooming
It's
of
my
cats?
belief. It's my belief that it's more behavioral. As far as biologic reasons for it, I don't have research that tells me that cats are resistant to tick-borne illnesses. I think it's more that they are more fastidious groomers. Cats are weirdos, and that's why we like them. They do whatever they want, and they accept us into their realm, but with reservations. So I think that's the best answer I can give you. Thank you.
Thanks, Jake. Okay, personal stories. Joe Marie Solet and Georgi Prevosti. Please. I wish I could channel Phil Donahue in my handling of the microphone and the audience, but I'm doing my best. Okay, you want to go first, Joe?
I think I can.
Go ahead.
So, good morning. I can't see because this is in my face, but I trust that you're really there. So I've been invited to talk about my personal experience, and I want to begin to say that I sure could have used Paul's TikToks, because I, in September of 2023, apparently stepped into a nymph nest wearing shoes and socks, but nonetheless got more than 30 bites on my feet. And I have pictures, but I decided not to show them to you. That's how bad they were. So I am going to reflect on my experience since then, and I'm calling my talk, Look Inside Your Sandwich. And that is because I've had some very interesting food experiences, even here on the Vineyard, where it is way better than on the mainland. So look at this sandwich. This is supposed to be turkey. This is supposed to be a turkey sandwich. What do you see on the bottom? Can you see it? Cheese. Yes, you got it. So I had a labeled vegan sandwich in Edgartown. It was supposed to be sweet potatoes and avocado. After the turkey experience, I opened up my vegan sandwich, and what do you think was in there? That's a good idea, but no, this time it was cheese again. And so my husband went back and showed them the cheese, and we got a $20 gift certificate. I think that's way better than anaphylactic shock, but I would prefer not to have that experience again in the future. I went to a very, very nice restaurant and gave a careful description of my allergy to the gentleman who was waiting on us. I explained this is not virtue signaling, this is a serious allergy, and my risotto came, and I carefully added, and there was something sprinkled on the top, and what do you think it was? Parmesan, yes, cheese, more cheese. So, I went to a Shake Shack in Harvard Square, which is where I live when I'm not on Chappaquiddick, and I ordered there the vegan burger, and within a couple of hours I was seeing stars, could barely stay conscious, terrible digestive impact. Later researching it out, guess what? They cook the vegan burger on the same grill as the bacon. Great. So let me say that I have had skin, I've had abdominal symptoms. I had a trip recently to urgent care where I can tell you the doctor in the city had never heard of alpha-gal. So I sat down with him and we got on the internet so I could show him for future people. The idea, I mean, Cambridge is close enough people from Cambridge come to the Vineyard, right? That you would imagine they would have a clue what goes on. No. So another thing you'll hear is, oh, so you can't have gluten? And you're like, no, this has nothing to do with gluten. But they want to help you be gluten-free. So get ready. A lot of people do not know what a mammal is. So when you say you can't have mammal meat, they say things like, what? No eggs? I'm not making this up. I even had a doctor say that to me. So could you just call out the names of some mammals for me?
Squirrel, possum.
I don't know, platypus. Platypus lays eggs. Kangaroos, by the way, are very heavy in alpha-gal. And even though the babies live in the pouch, they are born live. And there are people in Australia who have kangaroo burgers, and I would never want one. I think they're cute. But they go into anaphylactic shock at night. So, not kangaroo burgers. So, here on the Vineyard, my next slide, we have an ag fair. And so we hope here on the Vineyard people know the difference between a chicken and some of our mammals. I've been wondering if maybe, especially those of us who are leaving the island some of the time, should be carrying food cards. People don't necessarily speak English. They may be friendly, they may nod. You may think they understood what you said, but often that is not the case. What if we developed some food cards? You could help us with that. And that we could carry so that if we went food shopping, we run prepared foods, or we went to a food truck or a restaurant, we could show these and put X's across what we couldn't have. We could even say, take this back to the chef, right? And show him, I don't want any of these things on my plate. So next slide, please. So one of the things we can do for each other is find places that have food we can eat and that accurately label them. And I am a big fan of Lucky Hank's in Edgartown, where when they did not have ice cream I could eat, the vegan hostess at the restaurant gave me a pot from her personal supply. That's pretty great. Also, you will find that the Yum truck window at the Sunday and Thursday Artisans Fair is completely alpha-gal free. So at least a couple of times a week you can go out. Next, please.
How about good pierogi?
Just invite me over. Next slide. So I have started with a design for what I'm calling the AGF FSQ, the Alpha-Gal Friendly Food Service Questionnaire, and it goes several pages, but my idea is that some of the folks who are here today and others from public health should be able to get together and produce a questionnaire so that we can advocate and educate. And when folks want to go out to eat, the menus here will be properly labeled. This will increase the number of people who feel comfortable going out. It will make it way easier for the servers. And believe it or not, there are a lot of places in the country where people have alpha-gal, and they got it way before us. Maybe they'd like to come and visit Martha's Vineyard. After all, the New York Times is advertising us, right? So, next, please. as part of my journey, one of the things I discovered is that over-the-counter medications and prescriptions also have alpha-gal in them. And don't necessarily expect a city doctor or your pharmacist to be acquainted with what these are. And so I want to make you aware of this website, www.pillclarity.org. One of the leaders of this group, his name is Dr. Sachin A. Shah, did give a talk for the Vineyard Haven Library, and I do believe that is available to you. And he goes through quite an educational program for you, so warns you in advance about some things, but also lets you know that these services are available. If you would like to be an ambassador for Pill Clarity, and I actually reached out to them and said, try this, folks can become ambassadors and they can talk to their physicians, they can talk to their pharmacies and educate folks that your service is available. So you might want to do that. In terms of personal care products, I have to say that there are listings on the web of things you might want to try and you might want to avoid. Lanolin, for example, is a natural wax extracted from the wool of sheep. And an awful lot of those things you like to put on when you have a sunburn have lanolin in them, so watch out. But then the question is, how far should you go? And in part of my preparation for this talk, I kind of searched around. One of the things I found was there are even recommended toilet papers for people with alpha-gal. So in case you're looking, Angel Soft, Scott, and 7th generation are the recommended toilet papers. So next, please. So the question that has come up about EpiPens, and I was very interested to hear what was said already this morning. I was just actually surprised to be sent home from the Martha's Vineyard emergency room after 32 tick bites without an EpiPen. Because I thought, what if before my test came back, I went into shock, right? I'd be on Chappaquiddick. Not a great spot to be looking for help, right? So I don't know what the policy is now, but I wonder if that's something that should be revisited. So I do now carry one everywhere I go, and I also have in the folder with these a sheet for whatever relative or stranger happens to be with me when this happens about what they're supposed to do. So next, please. So we're hearing a lot about how much Lone Star problems are rising on the island. And we know that the CDC does require reporting of Lyme. But alpha-gal is not an infection, and the government, the United States government, does not require reporting. But again, doing a little research, states now require reporting. Arkansas, Delaware, Nebraska, North Dakota, Rhode Island, Virginia, and pending, as of March, Tennessee, South Carolina, and West Virginia. Given what's happening here, right, and potentially on the Cape and elsewhere, maybe this is something we should be advocating for, especially if having this data helps with the allocation of funds for further research. So what about treatment? And we're told there is no treatment, right? My work colleague, friend from Arkansas, when he heard I had this, said, oh, you know, We got this all over Arkansas. We use acupuncture. We use auricular acupuncture. That means they put a piece of metal in your ear and it stays there for a month. And my friend put me on the phone with friends of his who claim they were having reactions before this and they are not having reactions now. And there is a published research series. I hope there will be more for us to follow up on. I've also read and shared with some of the team members a recent article where they're now beginning to really understand some of the precursors for anaphylactic shock, and they may be able to help us organize our physiology so that we're less likely to have these reactions. So I think, there's a lot to be hopeful about here. Next. So I would like to suggest that we adapt and thrive. I'm planning to get a very large NIH grant to sample non-dairy ice creams. And I think, my Harvard credentials will help the federal government want me to have this grant.
Any volunteers?
Yeah, good. So these are three of my favorites. And it's interesting, you can see that alpha-gal must be increasing because it was easier to get these earlier. Even last year it was easier to get these. Now, if you happen to see a bunch of Oatly, I would suggest you just fill your cart with every one that's in there because people are buying them up. Next and final, it is absolutely true that sacrifices are required to assure our safety, but there is also, I believe, at least for us, a silver lining that these same dietary restrictions have historically been encouraged by folks who have ethical and religious concerns about the treatment of farm animals and about climate change. So there is, I think, some compensation for the anxiety and for the restrictions because the alpha-gal diet is better for the planet. Thank you.
Okay. So when I graduated college, I thought my life was just beginning. I moved to my dream city. I landed an awesome job. I was having the time of my life. It felt like nothing could stop me. And then overnight, my life drastically changed. My face was paralyzed. I had fatigue so debilitating that walking up a flight of stairs was a challenge, and brain fog so severe I had trouble forming sentences. I couldn't believe that this was my life, and that it would only be the beginning, just not the beginning I envisioned. So in the summer of 2022, I went to an outdoor wedding in upstate New York, and about a month after, I started having some strange symptoms, but it was still the time of COVID. So I chalked up my head and neck pain, trouble recalling words, night sweats, and other flu-like symptoms to the ever-evolving virus. But I kept testing negative, and something didn't feel right. And then one morning, I woke up, and I couldn't move the right side of my face. I began to panic. I thought I was having a stroke. So I went to the urgent care, where the doctor assured me that no, I wasn't, but that I had something called Bell's palsy. And I'd only heard of Bell's palsy because Justin Bieber had gotten it like 2 weeks earlier. She told me she didn't know what caused Bell's palsy, but that it was inflammation in the brain that causes your facial nerves to stop working. But I figured if Justin Bieber was fine, then I guess I would be too. Since I was already there, I asked her to take a look at an itchy spot I had on my back. She found a massive bullseye rash that took up almost the entire width of my back. I expected her to run some tests and tell me what was going on, but instead, she wrote me a few prescriptions, told me I would be fine, and sent me home. This would be the first of several times that I was failed by the medical system that was supposed to protect me. Unfortunately, that story is not unique. Countless Lyme patients go undiagnosed and suffer silently for years before getting a proper diagnosis. I walked out of urgent care, hopeless and scared. So I did what anyone would do, and I called my mom. And that ended up working out really well for me, because she's an amazing clinician who knew that Bell's palsy and a bullseye rash are telltale signs of Lyme disease. She got on a plane that day to New York, drew my blood, and tested it. The results came back positive. I had neurological Lyme disease. We caught it at the end of the acute stage and beginning of the chronic stage. She found me a Lyme literate doctor. Now, I would not be sitting up here today living the quality of life that I'm living if it wasn't for an early diagnosis. So thank you, Mom. She took me home to Atlanta for treatment for what I thought would be 2 weeks, became 2 months, became 2 years. In addition to Lyme, the tick that bit me infected me with several other diseases known as co-infections. I had brucella, babesia, and bartonella, all with their own hosts of symptoms requiring their own treatments. My experienced Lyme doctor told me I had the highest levels of babesia she had ever seen in her career. Babesia affected my neurological system in such a way that it made me feel like I was going insane. I suffered from severe insomnia. I would go days without sleeping. Additionally, the state health department called me up asking if I work in a lab with animals because they rarely see the brucella disease in humans. No, I work in finance in an office building in the middle of Manhattan, about as far away from animals as you could get. Brucella gave me countless fevers and night sweats. These infections also reactivated the dormant Epstein-Barr virus in my body, contributing to the never-ending fatigue, and triggered something called mast cell activation syndrome, causing me to constantly break out to full-body hives, sometimes even screaming out in fiery pain. So once Lyme enters the chronic stage, and you're dealing with all of these co-infections, there is no one-size-fits-all treatment. So for the next 6 months, I underwent intense IV antibiotic therapy, sometimes every day. I spent hundreds of hours in a hyperbaric oxygen chamber and took up to 42 pills a day. Treatment became my full-time job. I couldn't believe that this was my new normal. While the world around me kept spinning, mine remained still. So here's something about Lyme treatment that most people don't know, is when you do a treatment, like an IV antibiotic, you actually feel worse. And it's something called a Herxheimer reaction, or herxing, when the bacteria die off faster than your body can clear them. You're left with all these icky toxins floating around. And for me, it felt like my body was rotting from the inside out. So not only were the treatments hard, but the aftermath was often worse. But I quickly learned that it would have to get worse before it could get better. So I was constantly pushing my body to its limit all the time, and sometimes too much, causing my body to rage against me. My mom's incredible nurses saved me from many trips to the ER. Come December of that year, feeling about 60% better, and my face had healed, I decided it's time to get my life back. So I moved back to New York City, not knowing that I was walking into the darkest time of my life. I struggled with everyday life, and I was constantly having flare-ups. Friends would say, "You seem better now," or "You look fine." And although I might have looked it, I felt the furthest thing from it. By the time I finished my commute to the office, I was already running on empty, but I still expected myself to function like I was fine. I'd go to dinner with friends, hoping for a sense of normalcy, only to leave halfway through because my body felt like it had been lit on fire. Every waking moment was consumed with how horrible I felt. I couldn't remember what it felt like to feel good. And then one night, I had an extremely high fever. I ended up blacking out, and when I woke up the next morning, I was unable to move, and I was drenched in sweat. I thought I was dying. That was the moment that Lyme broke me. It broke my spirit. It sent me into a deep depression. I didn't have suicidal thoughts, but for the first time, I understood the desire to take away the pain. It was unbearable. I felt like I was drowning, and that I would be forever, and that no one would be able to save me. Crushed by the physical symptoms, and now the weight of it all mentally, I moved home again. I remember standing in the airport with tears streaming down my face, not knowing how I would carry my bags. Strangely, I didn't feel anger. I felt defeated. I felt numb, and I accepted that this would be the rest of my life. Back at home, I felt like a prisoner in my own body, at the mercy of a relentless disease. I was desperate to heal, so I found a new Lyme doctor and started a new protocol. But I didn't know if I believed that it could work for me. Around the same time, I stumbled upon meditation. I started to understand that maybe there was something to this whole mind-body connection thing, and that how you feel and how you think can impact your body. I realized that if I kept thinking and feeling like I would never heal, then I never would. So I started to meditate about what it would be like to live in a healthy body, something that felt unimaginable to me at the time. I started focusing on emotions like wholeness, love, and gratitude for what my life might look like if I were fully healed, and the mindset that would go with that. And slowly, through diligent practice, that voice became louder than the resentment, the fear, and the constant, why me? I started to relinquish the control I had over my life and began to trust that maybe, just maybe, there was a greater plan for my life. I felt a sense of peace in how my life was unfolding. I understood that I had to break in order to rebuild. But even as hope started to grow, I realized that deep down, I was scared to heal. Lyme had begun to define me, and I wasn't sure who I was without it. But meditation helped me peel all of that back. It helped me reconnect with who I was beneath the illness. And ultimately, meditation gave me the belief that I could heal. It was the missing puzzle piece in my healing journey. When I combined that inner work with the new treatments, it was like hitting a tennis racket in the sweet spot. I started to get better. Over that summer, my baseline improved. I'll never forget the day that I was able to walk 2/3 of a mile without stopping. And although I was exhausted at the end, I did it. The thick brain fog started to clear, and the weight of the depression started to lift. I found joy for life again, and I knew I was going to heal. A few months later, I started a new job, which was a huge milestone for me, but it wasn't easy. It took months to retrain my brain to think critically again, and work drained all of my energy. Every moment that I wasn't working, I was sleeping, I was doing treatment, or I was meditating. And that cycle lasted a full year before I felt like I was back to living a somewhat normal life again. And once I felt well enough, I knew I wanted to give back. So I joined the junior board of an organization called Project Lyme, one of today's sponsors, to help raise awareness, fund research, and help patients navigate this complex disease. Through it all, I felt more gratitude for my body and a love for life than I ever thought was possible, not in spite of what I had been through, but because of it. I'm especially grateful it led me to a meditation practice that I still do today. I wouldn't change a thing about my past because it led me to this very moment, where I can so proudly say that now, 3 years out, I've fully healed and I've gone from the victim of this disease to the victor over my life. So here's what I want you to take away. Check for ticks and advocate for yourself if you have unexplained symptoms. Or if you're deep in the fight against Lyme now, that this is hope, that you'll join me on the other side along thousands of others who have healed.
Any questions?
Under Our Skin. Your story, it mirrors what I saw in a YouTube movie that showed once in Edwardtown movie theater about 15, 20 years ago. It's called Under Our Skin. It's a 2-part movie on YouTube. You went through what this 2-hour movie explained. The end of it was that they were suspicious that both the CDC and the World Health Organization refused to acknowledge ticks as an source of epidemics. And I wanted any of the medical professionals here to both comment on the usefulness of this sort of old movie and also this theory about Lyme being dismissed. Thank you.
I'll have to check it out. I haven't
Any
heard of it.
comments? Yes, go ahead.
Jake, who's a veterinarian, I can say that throughout this entire morning, it has been so apparent to me that, yes, it's very important to know that dark skin responds differently to erythema, and yes, it's important to realize that people's rashes are all different and won't be necessarily made aware to the patient or the physician. But the most important thing, I think, is that our medical community, we live in a heightened community of Lyme disease on the Vineyard. But I live in Boston, where Harvard is the Mecca. And I cannot tell you the number of days that a patient comes to my office with symptoms that are definitely Lyme, and that doctors at Harvard have not tested for this disease. I call Jake on a daily basis to ask him questions about which PCR, how do I do that? Because that's not what I do anymore, but I certainly feel that our medical community has to really be ignited in terms of knowing that there are so many symptoms, not the obvious ones always. I had a patient on Thursday whose daughter was 19 and had 2 unusual seizures. And yes, she comes to the Vineyard on a weekly basis, and no one had done Lyme disease titers or all of the Tick-Borne illness. So I think that's really the push that has to happen, and it's not yet happening.
Okay, so I think we're just about out of time until our final performance. Oh, I'm sorry. This is Mom, right?
Yeah, I'm Georgie's mom. And I just want to point out that she was seen by a New York City doctor who did not give her doxycycline. They gave her Valtrex, prednisone, and Bactrim with the bullseye rash. I'm licensed in the state of New York. I flew up there. I didn't really know what I was doing, but I was like, we are grabbing this bull by the horns. We are not going to make this a lifetime illness. And I just did LabCorp tests. I did IgM, IgG, both were positive. And that's when I used to help the doctor. I had co-managed patients by the entertainment industry, diagnosed with Lyme. She's in Los Angeles. And she's get a coordinator as soon as you can. Here's what we're going to do. And we went through a course of IgM labs. First, we did the testing. And that's when she ordered the labs with her LA address. And the LA County Health Department called her and said, you know, you work in a lab with animals. Craziness. And she also said, get her an hypergraph chamber. You know, let her see there as much as possible. So, you know, along with that, just all of the nursing, all of the other reactions. I mean, I'm board in functional medicine. That's the way I practice. So there's a lot of support work that can be done alongside these really heavy treatments to help someone get through. So that's my wheelhouse. I'm not Lyme literate. I don't know enough. Much needed for learning here for me. So, anyway, we're just extremely grateful to be on the other side.
Okay, well, thank you. Georgi, our next speakers are the distinguished Sam Telford, the distinguished Dick Johnson, and very imported from Australia by way of Harvard University, Isobel Renai. These are discussing the latest findings in tick research.
Should I start?
Go ahead, Sam.
In the interest of time, I'm going to abbreviate my remarks. But I started working on Martha's Vineyard in 1992. It was the tick guy at the time was the late Burton England. He was in his late 70s, and he would go to the steamship every day to put pamphlets on the steamship. I couldn't get Boy Scout troops to help him out. No one wanted to help him. And so the Vineyard owes Michael Loper a tremendous debt for starting the Martha's Vineyard Tick Show. He was the one who received the 5-year community grant from the hospital and was able to bring Dick Johnson on board. We set up an environmental committee. Michael produced all of the locally branded content on the Vineyard Board of Health website, which is unique in Massachusetts. There is no other community that has this wealth of information generated by the community. So we owe him a tremendous debt. And so I've been working on Lyme disease for a long time. I was brought up here because I was starting the phase 2 clinical trials for SmithKline on their Lyme disease vaccine. My work as a postdoc was on the R&D for that vaccine. And Bert dragged me over here saying, why didn't you include the Vineyard? And I've been working on Lyme disease for 40 years, and I'm ashamed to say we have made no dent in the incidence and prevalence of Lyme disease and now the other tick-borne infections. And it's not for lack of trying. NIH has graciously funded every single bit of useful information in the United States on tick-borne disease, how to prevent, how to diagnose, how to treat. And so I've been very fortunate to have NIH money, and I'm here to say that we have some things in the pipeline that look very good. That is, Pfizer has a Lyme disease vaccine in advanced clinical trials, phase 3 trials, which will undoubtedly be available in 2027. It's virtually the same vaccine that I worked on with SmithKline in the early to mid 1990s. It was withdrawn because of a lack of market, not because it was adverse effects. And it's going to be the same effective and safe vaccine that the SmithKline vaccine was. So we have that coming up. The sad part of this is that it might reduce the momentum that we need to continue to attack these tick-borne diseases, because people say, oh, well, we've got Lyme disease vaccine, we don't need to worry about anything else to try to intervene against tick-borne disease. We've got the Mouse Against Ticks projects, where MIT scientists are trying to modify mice. I'm the ecologist for that and immunologist for that project, and we've got proof of concept mice, but that's 10 years down the line, but it's in the pipeline. We've got a new oral formulation based upon a veterinary drug, feed-through for dogs, which might be pressed into service to prevent tick bites, at least prevent them from feeding long enough. That paper is now been submitted for publication. So there are things that are coming up, but Dick will have the last word, I hope, on this. What we really need to do is prevent. The only way to prevent is to kill fear. I did my doctoral work running the first experiment on deer reduction and its effects on the tick population, and showed that if you reduce the deer herd by 80%, you reduce the tick population by 80%. And it's even more important today because deer are responsible for Lone Star ticks as well as the deer tick. So with that, why don't I turn the microphone over to Isobel, who might tell us about some of the things that she's doing to help the next pipeline for things of the future.
Hi everyone, I'm Isobel. As said, I'm all the way from Australia, so very, very far away. And my background, I've got a PhD in insect biology and genetics. So that's my expertise and our interest. And what I've come to realize is there is a lot we don't know about ticks themselves in biology, and that's really what I've been working on and hoping to be able to develop strategies to actually target the ticks themselves. So I'm currently a postdoctoral researcher in the biology department at Harvard University. What I'm going to quickly talk to you today about is sort of the international scene. So unfortunately, Martha's Vineyard and also America is not the only place that ticks are a problem. It's an international problem. And also give you a brief overview of some of my current research. Next slide, please. So earlier in the year, I was fortunate enough to attend a conference in Germany, which is sort of brings all the local experts and international experts working on ticks and these different kinds of diseases. And as I was saying, it's not just a Martha's Vineyard problem, it's not just an American problem. In Europe, they have Lyme disease, also known as Lyme borreliosis over there. They also have different kinds of diseases caused by different species of ticks, but similar kinds of diseases. They have a viral disease there called Tick-Borne encephalitis, which is very similar to Powassan virus here, with a much higher incidence rate, and a lot of fatal cases have historically been reported. It's currently the only human disease that we have a vaccine on the market for. So if you're traveling in Europe, or hopefully I speak to a lot of Europeans, a lot of them have been vaccinated during their lifetime against this one Tick-Borne disease. So there's a lot of focus on the tick research, also on these vaccines, and also on trying to develop better strategies to combat these ticks. And also, as we heard today, it's not just the human side, it's also animals, livestock as well. The ticks have a massive impact on the global livestock economy. They cause billions of dollars in loss in agriculture. So one of the key efforts that I've been really wanting to push is our understanding of tick biology and also bringing the tick biologist community together. We don't have any central resource places for the international tick community. We have some of these conferences and stuff, and that's what I've been really trying to bring together all into one place. So I'm very thankful to Paul and his foundation, because they have helped me fund the central repository where I'm trying to bring it together all of these resources. So next slide, please. So this is currently in development, so you're getting a first sneak peek to it, but as an example of some of the things we're working on, these are all international conferences that have been held on ticks. They started in the 1990s, and a lot of this information and the research that was done and published during these conferences have never been publicly available to anybody. They're basically in hard copies and have never been shared widely with the community, and I'm fortunate that I've been sent a lot of these resources and I'm trying to get them all digitized in one place. So this is all the very important research that's being done by the community hasn't been widely available. And also working on getting a central place for a lot of the initiatives and research efforts that have been done and into PDFs and all in one place. And then just talking in terms of my own research, next slide. So as we talked about today, the ticks are really at the center of all this. So whether it is viral infections such as Powassan, whether it's a bacterial infection such as Lyme disease, whether it is a protozoal infection, which is babesiosis, whether it's a nematode infection, which we haven't talked about today, but ticks can transmit nematodes, and then beyond what the ticks actually transmitting an infection, it can also, they themselves, their saliva, it can be neurotoxic in certain species, and then as a lot of people are getting affected here, the tick's saliva can also cause allergies such as the alpha-gal syndrome. And so for me, I'm really focused on the ticks at the center of all these different diseases that they are causing. Next slide, please. So inspired by what efforts have been done on other pest species such as mosquitoes and flies, I really want to be targeting the actual biology of the ticks to see if we can get a targeted strategy for the actual ticks. And we do this by trying to manipulate the development or mating of these different pest species. So that's actively what I'm interested in working on at the moment. So we've known about things like genetics and development for pest species like mosquitoes for sometimes decades. And for the ticks, there's a lot of the genetics and development that we're still trying to understand. They're very difficult to keep in the lab. We have to feed them, get them the blood. So it's very tricky to be doing this kind of work. So this is some of the work that I'm working on at the moment. So just to give you some brief overview of some current data that we've been looking at. Next slide. So this is with a student that I've been working with, Katie Dillon, and we've looked at all the different animals listed by the World Health Organization that causes disease that we currently know about their DNA, so we call that the genomes. So whether it's ticks or mosquitoes or bugs or snails or fleas or lice, they all cause disease in humans. But these are different species of them, and this is how much DNA they have. And I hope when I put to the next slide, what you can see is that ticks, these are all different tick species. This is the deer tick here. You can see how much more DNA they have compared to something like a lice. So they're very different biology of the ticks, and we're just starting to understand now about what's unique about these ticks and what is potentially the implications on their DNA and their genetics. Next slide, please. So the other thing that I'm working on is the ticks in the lab, their development. So we've talked about today, they start off their life cycle as these eggs. They hatch into these small little larvae that cause these tick-bornes. They need to go out and get a blood meal, so they'll feed on some small rodent, something like that. They progress to their next life stage, which is the nymph. Then again, the nymphs need to go out and get another blood meal, so they'll go and find a different animal to feed on. Then they progress to their final life stage, which is these adult stages of the adult female and the adult male. And it's those adult females that will go grab a blood meal, feed on the deer or something like that, and lay her eggs and start the whole life cycle again. As a lot of people have been talking about today, and as that picture shows, we actually only talk about females and males in that final stage of development. And what I'm really interested to see is what's happening at the early stages to see if we can manipulate the males and females at early stages of development. Next slide. So yeah, to highlight that you can really see there's physical differences between males and females at this adult stage that we can really easily see. So to get around this and to look at this earlier in development, what we've recently published a paper on is targeting the actual chromosomes of the ticks. So we know from earlier work that female ticks are XX chromosomes in these deer ticks, and the males are XY, so a bit similar to humans. And we've developed a test that physically targets the DNA of these ticks. So I can, sort of like a COVID test, I can take a bit of DNA from some of these ticks, run it on an assay, and I get a visual readout. So if it's one band, it's a female, and two bands, it's a male tick. And what we're doing is using now is to look at that in early stages of development and hopefully to be able to figure out the genetics and potential mechanisms that we can manipulate these ticks. And I think that these kind of strategies are really urgently needed. As we've been talking about today, at the moment, the best recommendations we have is to tell people to not get bitten by a tick and do these personal protection measures and prevention measures. And even the experts, as we heard today, you don't always remember that people might not even have access to the information as well that people were talking about. So I really feel like if we can be targeting the ticks at the center of this, hopefully we can have better strategies out there and prevent people from getting sick. So thank you.
Thanks, Isobel. Dick Johnson.
Hi, I'm Dick Johnson. I was the director of the Tick program that Michael Loberg started. He and Matt Poole basically ran it from 2011 to 4 years ago when I wanted to retire and Patrick miraculously appeared on the scene. So I don't work for anybody anymore, so what I'm saying here, my own opinions, does not necessarily reflect the opinions of the Tick program or anybody else. I can say whatever the hell I want, but I'm just me. Okay, really close. Thank you for sitting. You sat through a lot lot of information in the city for a long time. If you can tolerate a little bit more, I do have some things I'd like to talk about. I've been given the task of kind of summarizing this and then talk about where we head from here. I have 5 main points I want to talk about. So I'll give you the Cliff Notes version first, those 5 points, and then I'll expand on them. If you really can't stand the city variable, please turn to the short version. So 5 main points. The first one is there is no silver bullet. There is no simple island-wide solution. Nothing we can do that is going to solve the big problem on the island anytime soon that we know of. Second one is I think we have to think and work on a different scale, maybe town by town, even neighborhood by neighborhood. We can't solve the problem island-wide, but we can work on solving the problem in our neighborhood or in our town. And we got to take it, break it into pieces and work that way because there are things we can do, but there are different things in different situations. We have to think about what works where I live, what will help the people and my family, the people that are around me. There are several different solutions that I'll talk about. However, they all present political, practical, and financial challenges. Everything we want to do is going to take a lot of work. Most of it has to be approved somehow through Massachusetts Fish and Wildlife, which is a very bureaucratic and political organization. So it's going to take a lot of politics, unfortunately. Always some kind of politics and money. Because of those political challenges, number 4, we have to somehow, this is mission impossible, get the island to be moving forward in some sort of agreement, some sort of consensus, so we can go to Fish and Wildlife, so we can go to our politicians, to Julian Sir and Tom, and say, this is what we want to do, so we can push the things that we need to do. But even within this room, you see all the various, there's a lot of different ideas. When you get out in the wide world, there's so many different directions. Everything we try to do, just as many people saying, no, that won't work, we don't like it, yada, 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 as there are people saying, let's go for it. Somehow, we've got to get something where we say, this is what we need to do, this is how we do it. If we get that, I think the resources are there. And so the final thing is, to do this, to do anything on any kind of scale, it's going to take more staff, it's going to take more research on a much larger scale to date, and therefore we need more money. And just like everybody else, we have interns, we have people we can bring in, but there's no place for them to stay. So I think we have to actually think about housing. Short of cloning Patrick and maybe Heidi Gother, we're going to have to bring, we need help. We cannot do it. I did it for 10 years on about $30,000 a year, and not a lot got, some stuff got done, but it wasn't easy. Patrick is working on a little bit more money. He's at least full time now. But I know, because I've done it, and I also know how many requests for surveys and how many requests for plots get. He simply cannot do it. He needs help next year. So we really need to be thinking about that. So that's the short version. If you're going to stay with me a little bit. The no silver bullet. The island's large. There are, 3,000 to 4,000 deer on the island as far as we know. We don't really know how many deer there are or where they are. We're working on that. Poster child for the Samson solution is reducing the deer. The poster child for that is Mohegan Island, where they introduced deer, realized they made a mistake, went back and were able to hunt down all the deer, removed all the deer from the island. You don't find deer ticks there now. Lone Star ticks haven't made it that far, so we don't know about that. The problem is Mohegan Island is 1 square mile. Vineyard's 100 square miles. How on earth do you reduce the deer population 100 square miles? So as I said, I think it has to be on a smaller scale. I don't know whether we've been working neighborhood by neighborhood with homeowners association, with road association, trying to get them to come together and do something in their area. I don't know whether the answer is to go town by town, have each town have a committee and have them come up with the solutions that work for their town. Do we go to the Martha's Vineyard Commission, what I call, and see if they will put together a task force, try to get the whole island moving in one direction, come to some conclusions. We need to continue working group by group, homeowners association by homeowners association. I've seen it happen. I've seen homeowners associations who are absolutely opposed to hunting, want nothing to do with it. They're now going out and inviting hunters in because the ticks have gotten so bad. But it's going to get worse. The bad news is we haven't even seen the worst of it yet. There are going to be a lot more Lone Star ticks.
ticks. Long Island is about 15 years ahead of us. And believe that, trust me, you can say the end of it. The other thing I'd say for the moment, so what we can do right now, it all comes down to personal protection. Again, everybody said that, but I'll emphasize it again. You need to take personal responsibility for yourself, whether it's wearing tick pods, whether you're using repellent, whatever you need to do, you need to do what you're comfortable with and try to prevent the bites and do the tick checks, because overall problem's not going to be solved in the next couple of years. A couple different things we can do. Number one, I think the most important thing, as Sam said, and I second it over and over, we do need to reduce the deer herd. There's just too many deer on the island. Nothing to do. The bad news is that the Lone Star ticks also, deer are the reproductive host both for the deer tick and for the Lone Star ticks. In fact, Lone Star ticks, all three life stages feed on deer. Patrick can show you, he has some horrific pictures of some road-killed deer that are just crawling with Lone Star ticks, both nymphs and adults. So first thing, in terms of reducing density of deer, there's a couple more things we can do. The first thing is we simply need to have more properties, more of the island for bow hunting. Somehow we have to convince more people to allow bow hunting on their properties. The problem is that you cannot bow hunt, you cannot destroy a firearm. Bows in that within 500 feet of an occupied dwelling. It would be nice if we could change that to 150 feet. That would open up a lot of land for hunting. But everything we've heard, especially with Fish and Wildlife, is you better be careful, because that's a law. That's not a regulation. It has to be changed by the state legislature. And there are a lot of people out there, like the deer, who don't have the problem we have on the Vineyard, who are going to try to push that to 1,000 feet. So you got to be careful what you do. You may just make the problem worse. Anytime you go talking to the legislature about changing laws, you know, it's lobbying and money, it's a gamble. You're rolling the dice. Another thing, which I don't know much about, but you can ask Patrick more about it, we'd like to see all hunters be allowed to use crossbows. Right now, only you use a crossbow if you have a medical excuse that says you can't pull it. I don't hunt, I've never hunted, never tried any of this stuff, but from everything I've been told, the crossbows are much easier to use. They're more accurate, but they're also coming in. It takes a long while to learn to be a proficient bow hunter with that bow that you pull back. One of our problems is we just don't have it. We're short of hunters. We have a long bow and arrow season. We don't have that many people. And we don't have new people coming in. If you go and watch people checking the deer at the checking station, they're more like me than like Patrick. Our hunting population is aging. We need young people in back to sort of an elementary program. But we also, it'd be a lot easier for them to get started if they could use crossbows instead of regular bows. And I see the hunter in the audience nodding yes. So that would be another good one. Pardon? They have a trigger, yeah. This is, are any of the newspapers still here? Because I'm about to give you a good scoop. You want to know this? I just found out last night that they have extended the deer hunting season on Martha's Vineyard in Nantucket, areas 13 and 14, to include a January hunting season. I got this from a very reliable source. I can go on the website, so you've got a scoop there. This is going to be big news on the island. We are going to have hunting, looks like, in January this year. How much that will help, we don't know. We'll have to see. It's going to be a real management challenge, but maybe they'll take enough deer to make a difference. We shall see.
If I could interrupt 1 second, Buddy Vanderhoof, the famous Captain Buddy Vanderhoof, he brought me some venison sticks one day as a gift, and I said, Buddy, how far away from the deer were you when you pulled the trigger? He said, oh, I shot it with a bow and arrow. I said, you shot it with a bow and arrow? I said, Jerry, I'm an Indian. That's what I do.
You don't have to be an Indian to use a bow and arrow. Actually, on the Vineyard, if you look at the results, I haven't seen for this year, but most years we take as many deer with archery with bow and arrow as we do with shotguns. And some years it's more. So we have a lot of bow and arrow hunters, but there's only so many, there's only so much land they can hunt. So we need more hunters and more places they can hunt. As far as reducing deer, some people have tried various methods of contraception, sterilization, things like that. I know they tried sterilizing female deer on Long Island, and it was pretty much a disaster. They had some real problems. I only read the popular news account, so I may have gotten a bias, but it didn't seem to work, and it certainly stopped. Some of you may know that on Staten Island, New York, they are taking male deer and giving vasectomies, which makes no sense to me because one male can impregnate a lot of females, but a vasectomy is a heck of a lot easier. Just a snip than it is to do with to sterilize a female. I don't know. Well, there's more details, but we don't even. Only thing I do know is last time I looked, they spent $6.6 million on Staten Island. I don't know how big it is, but it's not any bigger than the Vineyard. It has fewer deer. They've already spent $6 million. They haven't solved the problem. I don't see us spending, first of all, getting out and sterilizing 2,000 deer. I don't see us spending $6 million to do that with any other solutions. Finally, the last one is one that I have always avoided, and I would have said, no, we don't want to go that route. But more people are starting to talk about it, and I'm starting to take it a little more seriously. There may be cases and places where we do want to bring in some sharpshooters. We may have to bring people into places where there's no hunting, we can't do other things, and it's a horrible thought. But maybe we can start doing a real culling of the deer. It's not one I like, but how many more people are going to get sick?
John?
Why is it a horrible thought to bring in sharpshooters?
Thank you all for really useful and interesting information. Dick, just with respect to your last comment, I'm curious, why is there a difference in reaction to bringing in sharpshooters as compared to ordinary hunters?
I guess because I feel like ordinary hunters at least give the deer a chance. If you're bringing sharpshooters, you're going to be shooting over bait. So you're going to be feeding the deer, and then coming in and blowing away. The image of these 50 deer coming in and feeding on the apples you've been giving for the past 3 weeks, and then pulling out rifles with silencers on them and start plugging away at the deer turns my stomach. Right? That's me personally.
I'd say you don't know who they are, they come from a fire.
I know, you can jack deer at night, but sharp. Yeah. Sorry, Elsa.
If I could comment, the resistance is mainly at the level of the Division of Fish and Wildlife. They view deer as a resource for all citizens of Massachusetts, and that it's a tremendous waste of our natural resources to have culling using sharpshooters. Besides that, it's logistically impossible. Block Island was to eradicate their deer. They had put down $1 million to do this with White Buffalo, a company that specializes in this. And White Buffalo pulled out within a week to go because they found out that silencers, suppression on firearms, was illegal in Rhode Island, and they could not do the job without it. And it's the same here in Massachusetts. Suppressors are illegal. So we just cannot do it without legislative change here in Massachusetts.
Bill in the back.
Dick, I've got a possible solution to your issue in regards to getting more deer culled. We have a striped bass and bluefish tournament. Why can't we have a tournament during November, December, January in regards to deer? And then I have another question that I have the 3 medical people who've spoken today. In my review of tick-borne disease and secondary symptoms, I've come across something that seems to indicate that the pathogens have an effect on human blood and change your blood chemistry to some extent. And I wondered whether any of you have been following any of that literature to see whether some of the abnormalities that occur with regards to human blood might also be an after effect with regards to tick-borne disease.
So it was mentioned that Tufts University has a research program now examining persistent persistent symptoms after having had Lyme disease. So NIH gave us $5 million, a large amount of money, 5 years, $20 million grant to recruit patients as they come in with their edema migraines and follow them for 5 years. Sadly, the number of enrollments we've had this summer has been disappointing. But that is precisely the purpose of this study, is to determine whether there are proteomic and other changes in a person's physiology as a result of having had and been treated for Lyme disease. So that's the bulk of the money. I have a separate, what we call it, R01 grant on the epidemiology of persistent Lyme disease. And the idea is that it's not just Lyme disease, but there are many other things in the woods that can contribute to ill health at the same time. Our current interest is mosquito-borne infections. Everybody ignores mosquito-borne infections, yet around here there's about 10% incident of prevalence of antibody to an infection called Jamestown Canyon virus. And so that is our number one suspect that we're working on right now. I'll be back in the fall to do a blood draw, and I drew Nantucket a month ago on Sean Island. We're doing Prudence Island, and we'll be back here on the Vineyard to do a blood draw of people at high risk of getting tick exposure. And so there is a study funded by NIH to do exactly what you're suggesting.
Kathleen?
A lot of my patients who were in the Lyme, the Pfizer Lyme vaccine trial we had a couple of years ago have asked me, what's the follow-up? And so to address that.
I consulted with Pfizer for their phase 2. I ran the phase 2 versus Lyme with Dr. Hoxie here on the Vineyard back in the mid-90s. And I was puzzled as to why they withdrew from Massachusetts and Rhode Island. They recruited people, they had given the first dose, and then all of a sudden they just pulled the rug out from underneath physicians' feet. And they said, oh, there were irregularities with with the paper trail. It wasn't that. I strongly suspect their statisticians were so good, they realized they didn't need as many subjects in their trial as they originally planned for, and that they could save an awful lot of money by just withdrawing from the 2 most expensive states to run studies in. That was my guess. However, the vaccine will be available in 2027. There's no reason on earth why it won't be approved by the FDA. And those people who received their initial doses can be boosted at that time. So it's not as if they're not, and in fact, whenever I do these blood draws, people come to me and say, I was vaccinated back in the mid to late 90s with this Lyme vaccine, and I have not had Lyme disease since. And I'm starting a study of that myself because I believe that there is residual effect of the vaccine even 20 years later. And so I will be doing that project next year after I accumulate enough blood samples to actually, what I'll do is inoculate mice with their serum, feed infected ticks on them, and see if the ticks become cleared of infection, which is the hallmark of this Lyme disease vaccine. So yes, you're absolutely correct. There are some people who were left hanging, but no worries, they can just get boosted as if they've already had the first dose.
I have 2 short questions. What happened to mice? We haven't talked about mice as a vector. And 2, what are the chances in this political environment of getting many of these grants just cut out from under your feet?
Yeah, that's a great question.
Getting vaccine approved.
No, I think the vaccine will be approved. RFK himself was grilled by Susan Collins and said before Congress, I have had Lyme disease, my family has had Lyme disease is at work. So at least from that top level, they're okay. Now, whether but our Lyme disease study, the second year of funding, the Tufts Lyme Disease Initiative Program Project Grant, received its notice of award for its second year a month ago. We were worried. I have another NIH grant for something else, and we received a notice of award about 2 weeks ago. So they're delayed, but they're funding them fully, and without reduction in indirect costs. But yes, you're right. I would not bat an eye. I'd be horribly disappointed, but I would not be surprised if I received an email from the night saying, "Oh, well, we're cutting you 30% or 40% or whatever." Yes, that is a concern. But what was your first question? Oh, the mice. So the Mice Against Ticks project is in its final year of NIH funding. So that my MIT colleagues are aggressively pursuing philanthropic support. They need another $1 million to carry this through to the point that I take over and get regulatory approval to conduct a small experiment in the field with the mice. I am anticipating it will take just as long to get regulatory approval to go to FDA, USDA, EPA, and all the national agencies, and then go to the Massachusetts Division of Fish and Wildlife and say, hey, look, these guys approved it, let us run a trial somewhere small, controlled, and get the data that's needed for a wider application of that technology. But the actual nuts and bolts were doing very well. The advances have been made, but this is a very expensive thing to do. MIT charges a fortune for keeping mice, and they need mice constantly because they have to get pregnant females and then remove the oocytes, manipulate them, and then implant them back into new mice. So it's a very, very expensive proposition. So, but nonetheless, the people at MIT are very committed to following this group. We just need to get some money to do it. It's unlikely we'll get it from the NIH right now. Research grants are being funded at the 2% level. That is, you have a 2 out of 100 chance. If you submit 50 grants, you might get 1. The pay line last year was 10%. I had a score of 11% on one, and I didn't get funded. And when Mr. Bush was in office, the pay line was 24. So the funding is very difficult to get right now from the NIH.
But that's not a lot of money if you combine Long Island and Tucket on Vineyard. $1 million?
It's true, but remember, philanthropists are being hit by many, many requests for many other very worthy causes, so they have to pick and choose what they find.
Some years ago, there was a cartoon in the New Yorker which showed Rome burning down, and the barbarians were riding their horses out of the town, and the lead barbarian says, the way I look at it, for generations, Rome had momentum. Now Visigoths have momentum. Here we are.
Can I add one thing? Can you hear me? One thing I want to add about the mice. One reason we haven't talked very much about the mice is because a lot of the focus today, I think a lot of people's concerns are on Lone Star ticks. Lone Star ticks do not feed on mice. They feed on medium-sized mammal, deer, maybe rabbit. We know they feed on turkeys. Turkeys are a big problem we find. In the Midwest, they call Lone Star ticks largely the turkey tick because there's so many turkeys. So the reason we're not very much focused on mice is because we're also focused on Lone Star ticks, and they have a whole different set of hosts. All 3 stages of Lone Star tick feed on deer, and they are the reproductive hosts. So we're going to do something about alpha-gal and the Lone Star diseases. It's deer, not mice.
The panel seems to be quite confident that deer is a major part of the solution, but your references to prior experiences are situations in which the herd was being culled to the point of near elimination. The number of deer per square feet here is huge, per square mile is huge. If in fact you reduce the deer population by 10%, 20%, 30%, is there research to suggest that that would have a significant effect? Or are we in a situation where we're talking about a level of hunting which really will eliminate deer for the most part?
We'll never eliminate deer. That anybody who thinks we're going to eliminate the deer and get it down to 0 is delusional. We don't have much research. What we do have is modeling that was done by the University of Connecticut. What's his name? Patrick? Kirby Stafford at the University of Connecticut. If you've ever read his Tick Handbook, if you haven't, take a look. It's the best single resource, more focused on deer ticks than written for Lone Star ticks are problem. But as far as deer ticks go, he estimates that if we get the population at about 15 per square mile, you will start seeing a drop off in the percentage of ticks and the number of ticks. And if we get down to 8 per square mile, the deer should become so rare that they won't be able to that they won't find, ticks won't be able to get together and make, I call the deer the singles bars, because that's where the males and females come together. If we get it to 8, so we're looking at the state, all from what I've heard, they think a reasonable level is 14 or 15 deer per square mile, which is about somewhere between half and a third of what we have now. So we're never going to eliminate deer. They're native species, they belong here, but we need to get them down to 15, 10, 12, somewhere in there. And that's not going to be easy, but it's at least a goal we can aim at.
Oh, hold on, wait till you get the mic.
I seem to remember a program, maybe as many as 10 years ago, that I was informed about for contraception. You've already mentioned this, but there was an active program, and I saw the feeding stations out in the field that were attracting the deer and had contraception.
Actually, that's going to be the next thing I was going to talk about, but I wanted to finish Alan's original question was, why don't we have a deer derby? And my feeling, and I'll look at Ed and Patrick to answer this, because I actually hunt. My feeling is the hunters are already taking all the deer they can. Every hunter's out there trying to take deer. Having a derby, I don't think will increase the effort that much. But I would defer to people actually hunt to say, you're right or you're wrong.
Ed?
As a bow hunter, I think first off, crossbows is the way to go. I have a crossbow license. You need a special license for that. I think they should make that much more lenient. It's a much more humane way to take a deer than with a compound. It also is much safer. You can get what you aim at. As we're saying, it's like a gun. And it would allow bow hunters, crossbow hunters, hopefully, would be able to hunt very safely close to home. So we suburbanized Martha's Vineyard. It's very difficult now to hunt with 500 feet away from a home. So I think we should make this a sort of a free, open season. It's going to be hard to do that, but a very long season. Allow bow hunters to use crossbows without restriction. You know, if you're able-bodied and you have license at the time, you should be able to use a crossbow. And that's a humane way to call the deer. What do you think?
I'm working on something that I hope will allow us to sell venison. Can you imagine what Martha's Vineyard venison would cost in the restaurants? It's a very healthy meat. And so ultimately it'd be nice to have a commercial season on beer, limited commercial season on beer. But it's a complicated political issue and you know, I have a lot of different things to do, so I can only work on it part-time.
Okay, we have two more questions.
Just real quick comment. Last thoughts on deer hunting and the deer derby. As I understand, bounties are explicitly illegal in Massachusetts, and I'm not sure how it kind of works for the fish derby versus deer hunting. But like Sam said, there's essentially a commercial ban on selling venison or any type of, I think even trading it for monetary goods. Like you're allowed to gift venison, but it's a very slippery slope. So that's why we did it started where anything we want to do with deer hunting, hunting regulations, it ends up being a very legislative and political battle. We have tried an incentive program out of the deer cooler before, and as I understand, when Dick kind of started that program before he started the job, Fish and Wildlife had threatened litigation, threatened to sue the Tick program, or whoever started this incentive program to incentivize hunters to take more deer. Because like I said, hunter maybe kill or freeze with one or two, and they're done for the season. So hunting is volunteerism. You can't demand folks go take out more deer. But we tried with an incentive program, whereas the state didn't really like that. Our current deer biologist, Martin Feehan, has been a partner for changing these things. And he's the reason why our season got extended to January. He's the reason why we're talking about crossbows and universal crossbow permits. So there is opportunity to change, but it is difficult.
Sam,
Any other questions?
what about predators?
So predators on deer? Well, you can speak to that better than I, because Naushon Island once had 300 deer, and coyotes came in, and now you have, what, 60 or 70? Although your ticks haven't disappeared, and sadly it's because Lone Star ticks are way more reproductive than deer ticks are. They lay 3,500 eggs. Deer ticks lay 2,000, so you'll probably have to kill more deer. But none of us is saying if you kill or reduce the deer herd, that's all you need to do. It's going to have to take place in the context of other things. Mice against ticks, personal protection, vegetation management, spraying is not a dirty word. There are many other things, and vaccination. There are people working on anti-tick vaccines, which would be way better than an anti-Lyme disease vaccine because it would cover everything that ticks transmit. But these are all, things for the future. But none of us is saying if you reduce your deer, that's all you need to do. You will still need to take personal protection measures.
One last question, John.
I have many questions, but I'll struggle and just ask one, more or less. Do you all have any idea why it is that the Lone Star tick has its own version of alpha-gal? What is it that determines the distribution of that amongst ticks? And I guess we should be glad that the deer tick and the dog tick evidently don't have it.
It's a tough question. People are trying to better understand that. It's probably more host related. That is, people vary individually in terms of how they respond to a stimulus. The other thing is that the tick probably modifies the alpha-gal when it takes its blood meal from a deer, for example. Alpha-gal is coming into the blood meal. The tick is processing that. It's digesting the blood meal in the gut cells, and it's modifying the sugars so that when it's spit back out with the next blood meal, it's presented as something foreign. And that's what people are reacting to. But it's not everybody who sees this tick and this stimulus will develop an allergy. And I defer to the allergist here, but how many people do you know have shellfish or peanut or other allergies? It's not everybody. We're constantly bombarded with these antigens. It's individuals who respond differently. So it's as much, if not more, a reaction on the host side as opposed to the tick itself.
I just want to add to that. So a couple things, Lone Star tick unfortunately does not require blood meal to transmit alpha-gal. That's why the larvae are our biggest problem. So they're born with this carbohydrate molecule, whether it's identical to alpha-gal or just very, very similar in their salivary glands. They can hit you as the first target, and you're still vulnerable to alpha-gal. So in that piece, the other thing is there are ticks all over the world that are not Lone Star ticks, and unfortunately, the Ixodes species in other parts of the world is responsible for the formation of alpha-gal. And I hate bringing this up, but there are some local studies, one on the West Coast and one in Maine, that indicate that there is a risk of alpha-gal, though small right now, and it's this very limited study that can be conferred from mice to Ixodes or deer ticks. So that's a problem, but it's not shocking considering that that's the case other places in the world. So.
Okay, before we break up, I want to do some self-promotion.
I haven't finished.
Sorry.
You anticipated where I was going next. You asked about these, what are called four posters. What they are, they put them out. It wasn't for contraceptives. It has corn in them. The deer come up, they try to get the corn, it rubs permethrin on them. It has rollers and rubs permethrin on them, which then kills the ticks on the upper part of the body. I've never been very supportive of those because they were used for deer ticks. They don't really work. Deer ticks are only on the deer as the adults in September and October and August. And you have to take down, by state regulations, you have to take down the four poster at that time month or 6 weeks before hunting season. So they don't really work with deer ticks. But when I'm rethinking that, and I'm thinking places where we can't hunt. If you don't want hunting, or you can't, it's not feasible, you can't hunt on William Street in Vineyard Haven. But you could put up a 4-poster. And because all the stages of the Lone Star tick feed on the deer, and they're there all through the summer, they do work. It's a lot more effective with Lone Star tick. So that's my second. Following reducing the deer herd is also using 4-posters. The problem is, in the past, was it didn't work with deer ticks. They're very expensive. It's going to take a lot of money. Each one is $5,000 a year, $10,000 a year. We need 100, that's a lot of money. We need 40, but we can figure that out. And then the third thing is that you can't buy the 4-posters without the permission of Massachusetts Fish and Wildlife. They will not sell them to us until you have a permit or a license or something from Fish and Wildlife. They don't like them because they congregate the deer and they're worried about all the deer coming in. If you have infectious diseases, we don't have chronic wasting, but they're worried about chronic wasting the deer. Anytime you bring everybody together, you have more chance of spreading infectious diseases. So that's one more reason you have to be political. We have to work with Fish and Wildlife if we want to put out the 4-posters. It's possible now that we actually have, that's just, I still got a little bit more, 4 minutes there, Jerry. The hunters also don't like because it puts permethrin on their deer. They want the organic deer meat, although there is no good scientific evidence that the permethrin gets into the meat of the same agent. So because all these approaches, everything we want to do is going to require, they're all somewhat controversial, they're all going to require the cooperation of Mass Fish and Wildlife, which is why I was trying to get a consensus on that, either through possibility of convening an island-wide task force or going town by town. When I talk to our representatives, they say, okay, you want to do something, I need the support. I need to see you have the support of all 6 island towns. They don't want controversy. It's a lot easier not to do anything, a lot less controversial to do nothing than it is to do something. Do something, you get in trouble. And so they want the cover of having the whole island supporting them. What else? There's some more research we have to do. We don't even know how many deer really. We don't really have a good idea precisely of how many deer there are, where they are. Jeff is working on that. He's working on this really with white buffalo again, the possibility of using drones to actually finally get us the data we need to understand the deer population. Another thing I'd like to see is we don't know enough about Lone Star natural history. We know they feed on deer, we know they feed on turkeys, so they feed on skunks, raccoons, to what extent, we don't know where they're picking up. As far as I know, unless Sam knows, we don't know where they're picking up the diseases. It's a lot. We don't know that much about deer ticks. We know a lot less about Lone Star ticks. There's a lot we have to learn. It's going to take staff, it's going to take money and people. And unless we can figure out how to clone Patrick, we're going to have to bring some other people in. The problem on this island, the same problem everybody else has, if you get a summer intern or you have a visiting research, where do they live? There's no place to live during the tick season. So what I'd really like to see in a little bit longer range plan is we need to be thinking about housing, someplace to put some housing up where we can bring visiting researchers, staff, interns, people like that. The good news is that we've had some interest recently from several wealthy donors, or a couple wealthy donors who are interested in maybe putting some serious money into this, much more than we ever had. So these possibilities are all opening up. If you know anybody else who's really concerned about this, and might be willing to contribute to the effort financially, we need that. If you have ideas about where we put people, that will be good. So what it's going to take is money and time. But meanwhile, we can try to reduce the deer herd and try to get the 4 posters out there. Thank you. Sorry I went so long.
Okay, so I want to really thank Jeff Levy and Liz Lapidus. They've done a wonderful job putting this conference together. Self-promotion. This is Oodles of Rubles, the Russian oligarch's confidential guide to real estate. I'm Martin Vineyard. Came out last week. It's at the bookstores. It's my book. I've been talking to my pen. And thanks everybody for paying attention.
I'm sure all of us will really answer more questions. If you still have questions, we can go out and stand on the porch. Let them shut this place down, but we're all happy to tell you what we know.